A very good morning to all of you. Myself, Dr. Kusum Singer. I am working as a scientist in PGIMER Chandigarh. I would like to invite you all in this one-day virtual workshop organized by PGIMER in collaboration with Cochrane India. The title of the workshop is Understanding the Cochrane Systematic Reviews for Dental Practice. The purpose of this one-day virtual workshop is to make the dental practitioner and dental researchers understand what is the Cochrane systematic reviews and how they can be done, and what is the importance of the Cochrane systematic reviews. I hope in the end of this workshop you will get a fair idea about all these things and many more information along with this. Now I would like to invite Professor Meenu Singh, who is supervisor of our team and head of the Department of Telemedicine and the professor in the Department of Pediatrics, for a welcome note. Over to you, ma'am.
Thank you very much, Dr. Kusum. And today we are going to have our first workshop on dental practice as applied to Cochrane methodology. And as we know, we have an Indian Cochrane network, which has been established last year. And we have 11 centers in that particular network, and PGIMER is one of them. And we have ICMR and PGIMER who are heading this particular initiative in India. And we, as you know, Cochrane collaboration is an international body which was started for having the best practices or the best evidence for healthcare practices. It has been operative since 1994-95, when the first colloquium, the Cochrane colloquium, was held in Oxford. And after that, it was taken to different countries. And now we have 150 countries who are connected with Cochrane. And we have thousands of researchers who are contributing to development of Cochrane reviews. And also there are other activities which are there in Cochrane collaboration. It is not only about creating best evidence in the form of systematic reviews, which are Cochrane reviews and are based on Cochrane handbook methodology, but it also brings out health technology assessments. It has a Cochrane register of trials. It has many other resources which are there, and we have our central Cochrane website, which is www.cochrane.org, and that's the one which gives a lot of resources, including Cochrane training, which is an activity which can be taken by members and also by other people by getting associated with Cochrane, and then they can see how Cochrane reviews are conducted, how other activities which are related to Cochrane are connected. They can also participate in the Cochrane colloquia, which are held every year, although we could not have it over the last couple of years because of COVID, but still a large number of activities have been going on. So it's extremely important that we become familiar with this body of evidence, which is and as evidence, you know, is nothing but something which is based on scientific research, which is critically appraised, and which is also acceptable to the population or to the consumer, because it is not only the guidelines which come out of the best practices or the evidence, it is also the acceptability of these guidelines by the physicians as well as by the consumers, which are patients, that these guidelines become operative and they become effective. And these days, there is a very important research area which has come up, and that is known as translational research. And that is also called as implementation research. We know that we have evidence that is available to us. We know that what works and what doesn't work, but still, when we adopt it or when we adapt it to our scenario, we find that somehow those things don't work, or sometimes what we find is that it is not implementable, and hence it's extremely important that whatever research is being done, it should be turned into practice. And that is what is translation. Translation from evidence to practice is something which is which is the new buzzword now. And we expect that all the policymakers, they should adopt guidelines which are coming from professional bodies, which are based on evidence, which are supported by international bodies like Cochrane. And of course, in social sciences, we have also Campbell collaboration, which is also extremely important work which they are doing, and that is related to the social aspects of evidence. And as you know, the social and societal aspects are extremely important. And following these systematic reviews, actually what one gets to do is what is known as health technology assessment. Several of these technologies will be discussed today, which are applicable to dental sciences. But we also need to know whether all of them or which of them are cost effective. That is number one. Which of them can be equitably applied to the population, which of them are ethical, and which of them are acceptable. So all these factors have to be studied after an evidence in the form of systematic review has been generated. And one needs to then implement them. So implementation comes after a technology has been assessed on various parameters, and then we try to take it up. For example, in dental practice, there would be several preventive strategies, there would be several therapeutic strategies. We know that dental caries is an extremely common disease in our population, and population in India is very, very resistant to going to a dentist, which is something which is always required. And we actually used to discuss a systematic review in which there was a comparison between the dental brushes, which are mechanical or electrically driven, and manual brushes. And there used to be a lot of discussion, and there were several systematic reviews which had been conducted on this. But here, I think even promotion of brushing teeth in children is something which needs to be taken up, and a clean mouth and oral hygiene, which is extremely important. And we have Laura Mishra here also today. They have conducted a lot of activities during the Oral Health Week, I think, which was going on recently. And we are very fortunate to have with us today Dr. Ashima. Dr. Ashima Goyal. She is a professor of dentistry in our Institute of Excellence Oral Health Sciences Center. And she is going to be talking about priorities in dental research. She will be formally introduced by Dr. Kusum Singhal. And we know that priorities are the first thing that we have to decide as to. One is that what is a priority for research? And secondly, whatever research has been done, what is the priority for doing a systematic review and then accepting it as a priority for implementation? So these two things are extremely important. And their center has actually done a lot of national level work and has contributed to development of ICMR guidelines and ICMR modules for dental caries. And the center is also doing a lot of work on preventive and curative, both the aspects, and also educational aspects which are there. So we also have Dr. Arpit with us, who's also a faculty in oral health sciences and has done several systematic review. And I really feel that today we are having all the Cochrane, Indian Cochrane network participants here. Dr. Bhalendra is there, who's from PGIMER Lucknow, and Laura is there, and Dr. Panda is there. So all these people have been doing a lot of activities now in the Cochrane field. And I think I'll now request Dr. Kusum to introduce Dr. Ashima Goyal.
Thank you, ma'am. Today we have Professor Ashima Goyal and Dr. Arpit Gupta for chairing today's workshop. Firstly, I would like to request Professor Ashima Goyal for a talk. Professor Ashima Goyal is a periodontist and working as a professor in the Department of Periodontics and Preventive Dentistry at Oral Health Sciences Center, PGIMER, Chandigarh, from where she studied her post-graduation with a silver medal. She has passion for research and a keen interest and a vast experience in the systematic reviews and the meta-analysis. A very warm welcome to ma'am, and over to you.
Thank you so much, Dr. Kusum. And thank you so much, Dr. Minu. It's indeed a pleasure to be here this morning to share my views on the priorities of doing systematic analysis in dentistry. Dr. Meenu has been associated with the systematic reviews for decades now that I've been seeing. She is an academician par excellence, and she has a passion for research. And many such workshops have been conducted by her over the years. And way back when I was a senior resident here, I attended one under her expert guidance. That was the first introduction to this. And today I'm here to share some of my views on priorities for evidence synthesis in oral health. Thank you, Dr. Meenu, for giving me a chance for this. So, we all understand that oral health literature has increased tremendously over the last few decades. But do we really still understand that what are the best oral health community programs for rural areas? Which is the best preventive agent for early childhood caries? Or what is the association of tobacco with oral cancer? These are just 3 examples that I have put before you. There are so many questions which come to our mind, when we have to do our clinical practice. This is because all the individual studies have got varied conclusions, which make clinical decisions extremely difficult. Which preventive agent to choose, which treatment modality to choose. And we all come across on a daily basis news from print media or social media, flashing exciting and sometimes controversial findings from recent studies or trials. But should we as scientists or the public take these results at their face value? It is very difficult because individual studies cannot give us a complete concept of the treatment to be carried out in our patients. The answer for sure lies in evidence-based synthesis or synthesizing the findings of the literature on that particular topic. What is evidence-based synthesis? All of you understand that it is basically a methodological and comprehensive literature synthesis, which is focused on a well-formulated research question about the answer which we want to know. And it clarifies what is known and what is not known about a research question. And it is actually conducted in an unbiased, reproducible way to provide evidence for our clinical practice and policy making, and also to identify the gaps which exist. It also provides clinicians with clinical guidelines for practice. So here lies the importance of evidence-based synthesis. So this is actually a step-by-step approach in which the various facets are interlocked like a jigsaw puzzle. So to start with, we have primary research or a basic question that we formulate. And based on that, we do the critical appraisal of the literature, do a systematic review, followed by effective dissemination of that systematic review through researchers, policymakers, professional and dental care organizations, and certain industries, and also through undergraduate and postgraduate continuing education programs. But what is sometimes missed is its effective implementation. Whenever we come out with outcomes based on our systematic research, do these outcomes hold any importance, or are these actually used by the clinicians for the benefit of their patients? This we need to discuss and actually implement. And this whole exercise again gives us a feedback to go back to the primary research questions, and sometimes we update our systematic reviews. Now, the evidence-based synthesis has to be based or should be carried out on certain important principles, being inclusive, rigorous, accessible, and transparent. Inclusive, I mean that multiple sources of evidence need to be consulted in order to answer that research question. and range of skills and range of people should be part of that systematic review, then it has to be rigorous. That means it has to be reviewed as a part of quality assurance process. Whatever time we have at our hand or whatever resources are available to us, we still have to find out the maximum number of articles which have been done on that particular aspect and then give a quantitative and qualitative analysis. Once we are done with our review, we should see that it is accessible. That means it is written in plain language. It is actually done in a suitable time frame and not take years for us to answer to that particular question. Otherwise, it loses its importance. And it should be freely available online. The most important principle is the transparency. We need to identify the research question, the methods, the sources of evidence and quality assurance process, and we need to communicate both the complexities as well as the areas of contention, and also acknowledge the assumptions, the limitations that we have come across, the uncertainties and the evidence gaps, because this will help us to carry out future research, whatever is missing in the existing literature. And we also need to declare the personal, the political, the organizational interests, and also manage the conflicts. Now, all these principles which I just mentioned help the researchers, the policy makers and others to commission, to do, to share, to appraise, and use the evidence synthesis. Common types of evidence-based synthesis are the narrative review, the critical review, scoping review, systematic review, and umbrella review. But there are lots and lots of different types of reviews about which you also know, and some of the speakers would also be contributing. Now, this is something which we need to understand, the evidence-based pyramid. Initially in 1998, we had a traditional pyramid where the research or the studies were arranged in a hierarchical manner, going from base to the top, starting from case series or reports to systematic review and meta-analysis, which is the most complex or the most sought after. And you can see solid lines or airtight compartments between the different types of studies, which was given at that time. But if you look at the revised pyramid, which has come up in 2016, the solid lines or the demarcations between the different types of studies has been replaced by wavy lines. That means there are no airtight compartments, but there is a clear interaction or an association between different types of studies. And top, if you see the systematic review or meta-analysis part, the tip that has been chopped off, because we want to understand that these systematic reviews and meta-analysis are actually a lens which provide us the evidence based on the studies which are given down below. Coming on to evidence-based dentistry, which is the topic for today. We know that there has been an increasing interest, which is evident in the different dental associations. There is a collaboration between individuals and organizations to exploit the CVD to improve the patient care. And there has been an increased number of systematic reviews registered with Cochrane Oral Health Group, about which Dr. Meenu just mentioned to all of you. Now, this Cochrane Oral Health Group, it works on a trusted evidence, informed decisions, and better health. The Cochrane Oral Health produces high quality, priority, relevant systematic reviews on preventive dentistry, diagnosis, treatment aspects, and rehabilitation of oral, dental, craniofacial diseases and disorders. I would like to share with you 7 stages of the Cochrane Oral Health Priority Setting Program, which all of you must focus, because this is the way that the Cochrane Oral Health works. Number one, they examine the data on how the existing reviews, which have already been done, are being used by the dentists or the other scientists. How often they have been cited, downloaded, and discussed on social media. Now, this information will give them a clue like which systematic reviews are actually important, which need to be revised, and which have got a low priority. Secondly, they also study the areas where new trials have been registered. Like all of us, we keep putting our topics. So all these topics or the new trials which we want to carry out are being reviewed by them. They also evaluate the guidelines which have been developed for dentists and the healthcare workers on prevention of oral diseases, on the best treatments for keeping the mouth, teeth, and gums healthy. And next is they also gather opinions of patients, the caregivers, and the general public. Again, the aim is in order to understand like what do the people really think about their oral health? What kind of questions we as scientists need to answer? So accordingly, the systematic reviews are planned or the priority areas are decided. Now, all these 4 stages, which I just enlisted, the data is then mapped, gathered in these stages based on the current reviews, protocols, registered titles, and to see which priority topics are new and which relate to Cochrane oral health reviews that already exist there. Again, I would like to repeat that even if the systematic reviews are existing, those are again considered and updated, and the new ones are also taken. 6 stages, identifying the priorities and presenting these to a panel of stakeholders. What do they do then? These stakeholders, then they rank the topics in order of importance with an aim that a manageable portfolio of priority reviews are present, because it is not humanly possible to carry out all the systematic reviews. So a priority list has to be prepared. And then is the development of an implementation plan so that the highest priority questions are developed and answered by either a new or existing Cochrane oral health systematic review by updating it. So this is the website of the Cochrane Oral Health, on which they have enlisted the various priority areas on oral health care, on which we as researchers and dentists and scientists can carry out systematic reviews and other types of reviews. So I have tried to divide some of these areas into 3 broad headings, because these were the areas existing on the website where they had put an asterisk, meaning that they would like to conduct systematic reviews on these aspects. The first and foremost is periodontology, in which management of cardiovascular disease in patients with chronic periodontitis has to be seen or studied. Home use of interdental cleaning devices in addition to toothbrushing, about which Dr. Meenu was mentioning. Treating the periodontal disease for preventing adverse birth outcomes in pregnant women. Systemic antibiotics for symptomatic apical periodontitis and acute apical abscess in adults. Chlorhexidine mouth rinse as an adjunctive treatment, and antibacterial toothpaste. The second most important topic is the preventive and community dentistry, which includes work on water fluoridation, interventions with pregnant women and new mothers, school dental screening programs, and primary school-based behavioral interventions. Also, a topic on oral cancer that I have picked up from there is interventions for the treatment of oral and oropharyngeal cancers, that is the surgical treatment. There are lots of other topics which all of you can go through yourself. Now, I saw the literature and found out that in these areas, which systematic reviews have already been carried out, which can for sure be updated, and related systematic reviews can be carried out. As far as periodontal aspect is concerned, a review which recently came up in 2020 on periodontal therapy for primary or secondary prevention of cardiovascular disease in people with periodontitis. Also another review, treating periodontal disease for preventing adverse birth outcomes in pregnant women. This was published in 2017. In prevention of dental diseases, we have a review on water fluoridation for the prevention of dental caries, published in 2015. Then we have one from our own department, topical fluoride antibacterial agent combined therapy versus topical fluoride monotherapy in preventing dental caries, a systematic review and meta-analysis. And the main person was Dr. Arpit Gupta, to whom you will be listening towards the end of this session. Prevention of oral diseases in high-risk groups. This was published recently in 2020, that is interventions with pregnant women, new mothers, and other primary caregivers for preventing early childhood caries. Oral health-based evidence synthesis in health economics, again carried out by Dr. Arpit Gupta et al., modeling the impact of increase in sugar prices on dental caries in India, a recent systematic review. Another one on clinical decision analysis, that is a systematic review of the quality and scope of decision modeling studies in child oral health research. So after showing you just a few examples of the systematic reviews, because I wanted to motivate all the postgraduate students as well as the young and senior faculty that systematic reviews are being conducted, high quality ones, in oral health care and dentistry as well. And it becomes important to pick up all those areas which have been highlighted so that we from India come up with good systematic reviews. I would like to say that best evidence synthesis generates and defends conclusions based on the best evidence available. But if somehow the evidence synthesis concludes that the evidence currently available does not allow for any conclusions, no problems, because that is again an important finding that we need to carry out further research in that area. In the end, I would like to quote Albert Einstein that the important thing is to never stop questioning yourself. So all of us as dentists, we need to formulate research questions and try to dig out the literature and try to find answers to that, or conduct research in order to get good conclusions for our clinical practice. Thank you so much.
Thank you, ma'am. Thank you for such an informative talk on priorities of evidence synthesis in oral health. Actually, you have provided many topics, many topics of the priority to our participants who actually wants to do the systematic review in the oral health care. Any questions you want to ask from Professor?
I just wanted to make a comment, Dr. Kusum. It's really a very impressive talk by Professor Ashima. And I think prioritizing the ideas for doing research and systematic reviews is the first step which all evidence-based medicine agencies must take. And I think Dr. Goyal has actually provided us with guidelines for how to do that, and has also listed some of the topics which are of extreme importance in the dental sciences. So thank you, Dr. Ashima, for that wonderful talk. And we can now have comments and questions from others. Dr. Laura, Dr. Pradnya, would you like to say anything? Dr. Balendra?
Ma'am, Ashima ma'am just touched a very close topic to dental, although there are many reviews on the medical side, but unfortunately dental does not have that many Cochrane reviews. But yes, as she said, that prioritizing the questions, the research question is very important, and we should do more and more of this, and we should also focus on not doing any research wastage. because at the end of the day, we want to benefit public out of our dental practice. So thank you, Ashima ma'am. Thank you so much for giving an insight on this.
Thank you, Dr. Lora. Thank you so much.
Thank you, ma'am. Before inviting our second speaker, I would like to request you all who are not able to join through the Zoom platform, please join through the YouTube link you have provided in your chat box. Actually, we are not able to accommodate more than 100 participants at our Zoom platform. So kindly join through the Zoom. Now I would like to request Professor Laura Mishra. She is presently working as a faculty of dental sciences, Shiksha House, Anusandhan University, Bhubaneswar, Odisha. She is a deputy director of ITS Cochrane India Affiliate Center. She has filed for many patents, and nurturing creative minds is her goal. She has published many systematic reviews in high index journals. Now, today she is going to talk about the importance of Cochrane systematic reviews versus non-Cochrane systematic reviews. A very warm welcome to Professor Laura Mishra. Over to you, ma'am.
Hi, am I right? You're Kusum, right?
Yes, ma'am.
Yeah, so I've been communicating with you from past so many days. Hi, Kusum. Good morning. And hello, Meenu ma'am. Good morning. Can you just enable my share screen, please? There are two windows from which I have joined. So kindly enable where I've written Dr. Laura Mishra, or probably just Laura Mishra can be enabled.
I think now you can share your screen.
I can do that. Thank you so much. So without wasting much time, very, very warm good morning to everyone virtually. And my topic is importance of Cochrane review versus the non-Cochrane review. I am Dr. Laura Mishra, and I am faculty in Institute of Dental Sciences. And I'm currently professor in Department of Conservative Dentistry and Endodontics. So it's very important to understand before you start with any kind of review, you need to understand that why do we need to do this? So it is very important that whatever knowledge you're going to gather in these webinar topics, it is of no value if you're not putting it into a practice. So I feel that there are evidences which are available with us. There are different platforms on which these evidences are available. And however, if we just have the information and we do not apply it on our clinical field, then it is of no use. It is benefiting no one. So the aim of this entire presentation is going to be that how you're going to apply this evidence and how Cochrane reviews play a major role in that. So when you are, younger, when you're in school or when you're doing your BDS or MDS, you basically gather knowledge, right? From the books, from the textbooks, from your mentors, from your teachers. And when you do an MDS or probably when you go for higher training, you tend to acquire whatever knowledge you have acquired in your UG side, you try to apply it in your higher studies. But if you want to be an expert or you want to do a practice better, so you need to understand that you need to analyze the information what is given to you, synthesizes and evaluate it. That is the most important part when you are thinking like a professional. Just because one thing works in certain clinic or other thing does not work, your opinion cannot be based on what you do in four walls. It has to be based on what is present and what other people are doing. And on basis of that, you need to take a decision and provide best clinical decision to your patients. Okay, so it is very, very important that this is a Bloom's taxonomy, which critically thinking Bloom's taxonomy usually explain that what is a higher order of thinking. So remembering and understanding and applying that we have done in our UG and probably PG studies or MBA studies or whichever undergraduate or postgraduate program you have joined. But when you are in your clinical practice, whatever information or whatever evidence you have, you need to evaluate, analyze it and apply it. So this entire presentation is going to be that what is going to help you in achieving, analyzing the evidence which is available and how you're going to evaluate it. Okay, so how do you find clinical answers in your day-to-day life or intervention. Okay, so if I have to ask you certain clinical question, or your patient comes and asks you certain question, how do you usually do it? I know for sure that when I was not introduced to systematic reviews, probably I was just going to Google, and in one click, all the information was available to me. So this is what it is, Google has made it easy. Instead of going to the books, we are just checking out the Google website, and we are, finding out our answers. But is that the right way to go? Because if I have so many questions, or my students ask so many questions, as patients who ask so many questions, as Meenu ma'am already said, there's a Cochrane review in powered brush versus manual brush. So in my field of conservative dentistry, endodontics, or in general dentistry, these are questions which we come across, right? We come across that, is powered brush better than manual brush? If your patient is asking this, how are you going to answer it? Are you going to answer this question with your personal experience, or you're going to go back to certain kind of evidence? If I ask which filling is better, amalgam and composite, so you might have done few composite restoration which would have failed in your clinical setting. So on basis of that, you're going to make a judgment that composite restoration is not good, is not right. So you need to look for evidences in these aspects also. And then how to manage bad breath, or how to manage halitosis. This could be a concern of a patient. So what do you suggest? Do you suggest them chewing gums? Do you suggest them to brush twice? Do you tell them to clean their tongue? There are a lot of options which are available to us. So how do we make use of the information or the question which is asked by the patient or by your students, or you yourself are asking that question? How do you reach that area? How do you come and answer those questions? So if I go to Google, and if I want to search that which is better, powered brush or manual brush, I will get this many numbers answers, So these are the topics which discuss about powered brush versus manual brush. So what I'm going to do, am I going to click the first one which is available here, electric brush versus manual brush, which is better? That is what we do most of the time, isn't it? The top slot of the Google is highest paid. So any Google website person, or who does all these website management, and you want your question to be on top, probably you can pay them a couple of bucks and your question will be, on the top, or you probably sponsor it, or you advertise it. And on basis of that, you're going to give answers to your patient. How do you know that the answer what the person is giving is correct, or is it ethical? So you need to understand that you cannot rely on too much evidence. In the further presentation, I'll show you that how I'm going to correlate this. So too much evidence creates a lot of noise. You need to filter it. And that is where secondary research comes into play. So if you have something ready-made, secondary research is like a ready-made recipe for you, where you do not have to experiment much. You just go to that secondary research like systematic reviews and meta-analysis, and you can get your answer very easy. And usually what you would do is that what are the ways you can answer this question would be probably conduct a trial or an experiment in your setting. Okay, search and appraise the randomized control trial which is given to you. Conduct a systematic review, ask your faculty members, or take a wild guess, and probably the first thing which comes into the Google would be the right answer. But all these things which I have listed out, they cannot give you the answer immediately. Okay, and if you need an immediate answer to a question, then probably systematic review are the best way to approach it. So I'll go back. So these are the questions which are usually asked by the patient, like, is power brush better than manual brush? So as a dentist, you have to think on what basis I'm going to answer the patient or the student, or how am I going to answer this myself? So is powered brush better than manual brush in cleaning the teeth? Is powered brush, manual brush better in plaque removal? Is it better in, stains removal? Or is powered brush effortless than manual brush? So these are the questions which will come in anybody's mind. The same thing if I'm asking whether the amalgam restoration or composite restoration, which is good for posterior teeth, which filling is good. So what studies or what questions I should follow it up with? That what is the lifespan of both the restorations? What are the chances of getting secondary caries in the both? And which is more easy technique, which is more difficult technique, and obviously the cost factor. So these are the ways which drives our decision making. And if I ask what are the interventions which can manage the bad breath, so probably there are so many things which are available in the market, advertisements, and a lot of information in the books, journals. You can You can suggest chewing gums, you can suggest mouthwash, you can suggest brushing techniques, or probably treat an underlying disease if halitosis is associated with. So, or any question which is thrown up to you does not have a single answer to it. Whereas a systematic review has a very focused question, and it usually addresses all these questions very easily. If evidence is there, it will answer. So I'll go back. So let me just take one example, powered brush versus manual brush. So when I was studying, I came across this article, which is published in a very good journal like BMC Oral Health, which is having a good citation, good impact factor. So I took an individual study, and I wanted to know that what is the oral cleanliness of daily users of powered brush, manual brush, and they did a cross-sectional study. So I make a KWL chart, that what I know about the topic and what do I want to know and what I'm going to learn when I'm reading this journal or this article. So what I knew about it, that powered brush is battery operated brush. Therefore, the effort of using powered brush is less than the manual brushing. This is what I already know. What do I want to know? That which cleans better, which is effective more. So I read this article, and I got to know that young adults have difficulty in achieving oral cleanliness, even if they brush their teeth with best of the appliances available to us. So it is more of a technique than the instrument. So this is clear from this journal. And no advantage of daily powered brushing over compared to manual brushing. So this article clearly says, see, whatever equipment the young adult is going to use, if the technique is wrong, it is not going to clean the teeth. This was the inference of this particular cross-sectional study. Okay. I searched another article. Are there any other article which is supporting this evidence? So I came across the same thing. I made KWL chart for this as well. And what did I learn? That a single-use sonic toothbrush shows significant greater reduction in plaque compared to manual brush. So that means sonic brushes are better. So now I'm confused that one article is saying that the powered brush and manual brush there is no difference. And another one is saying definitely powered brush is better than the other one. And both of them are published in a very good journal. They have a good sample size. So what is the answer? So I'm going to do what with this information? So both the articles have contradictory information. Do you get it? So one article might support the powered brush. Another article might just say that there is no difference. So how am I going to come with answers? So it confuses me as further. So maybe if I know a lot about methodology, I will critically appraise these individual articles, and I will ask which study design is better. So I will see this is cross-sectional study. The other study is a single cohort crossover clinical study. So not much difference. Then probably I will see the sample size, and then I will see that how the evidence is collected. As Ashima ma'am in previous, in her PPT, she clearly told that the evidence is, constructed in this way, that where you give opinions and anecdotes of an individual of weakest evidence, they are of weakest evidence, and meta-analysis and systematic reviews, that is secondary type of research, is of strong evidence. So when I have a systematic review, and if it could answer this question for me, my job is much easier. Okay. So types of evidence which are available to us in daily basis, it can be characterized into good or bad, and that can only makes us confused. And if we do not have that much time to critically analyze each and every article, probably just by picking a systematic review would make our life so much easier. Okay. So a lot of fake news, a lot of fake information, a lot of things are available in the net, and we cannot believe everything, and we cannot trust everything. And there are types of information which are available to us in filtered and unfiltered research format. So for us, if we need to find out an answer for a clinical question, probably we need to go through filtered research, if not any research, if there are plenty of research done on that particular topic. So powered brush and manual brush, a lot of studies had been done before. So probably instead of going through an unfiltered search, we can go check if there is any systematic review available with it. So what we usually do, but should not do, is that whenever we are having a clinical question, we see the number of citations of particular article, and we determine, okay, this article has large number of citation, it must be good. More recent the study, better it is. No, it is not true. Just because the study is, latest, if they have not used the methodology correctly, and if you critically appraise it, you might find more flaws in it. Okay, more popular the author, better is the study. That is also not right. Any evidence which is available in the net or to you in your journal books, you can critically appraise each one of them, and you should not believe just because what other people are saying. You should just go by it. Okay, so free PDF version available, hence the study results are taken as final inference, because most of us do not have access to good publications house or something like that, so we don't get the correct information. And developed countries versus developing countries, that is a major flaw which I see, that many good articles are published from developed countries, and developing countries articles or their data is not given much of importance, because they don't trust the methodology what we do, and where the study was conducted. That is also very important. So if it is some trial which has used multi-center trial has been done, or if the study has taken large number of sample size, then definitely that study would have a lot of weightage in your decision making. So what systematic review does is that it makes the decision making very easy. So you have one study, one trial with limited result, whereas a systematic review takes multiple trials answering the same question and club them together and then give a final answer. So each trial should answer the same question asked and should have similar parameters. So for a systematic review, you will collect 10 of those trials, 10 studies, or 10 observational studies, or non-randomized control studies, or mixture of all this, and then create a systematic review. So systematic review makes clinical decision making very, very easy. Just why do we make the review systematic is that the question in a systematic review is very, very focused, whereas in review it is having broad spectrum. So focus question is that which brushing, powered brush is better or manual brush is better. That is like a focused question. Whereas a review can be types of brushes which help in plaque removal, or review can be on a broad spectrum, or in, aids which help in plaque removal. So that is more of a broader aspect. The sources are very, very comprehensive, and explicit search is used. Whereas in review, it is the choice of the author. He can take certain articles, he decides to, not to take certain articles, or what is available to him, that is given. Okay, the selection of the studies follows a very strict criteria, whether it can be included in the systematic review or cannot be included in the systematic review. Whereas review can be biased. As I said, that it is an individual's opinion whether he can take the study or decides not to take the study. And appraisal is done. That means each study which is part of the systematic review is critically appraised. A scoring is done, how much they have scored individually, and that is given explicitly in a systematic review, which is not done for reviews. Okay, or it might be done, but it is not mandatory for reviews. Okay, so the synthesis is qualitative analysis of all those data which is given, and it is present in a very structured way. And if it has statistics, so probably we need to do a meta-analysis. You need to also infer the data which is given to them, and the inferences are only evidence-based. Whereas in review, it might not be evidence-based. It can be just personal author's opinion on it. Okay, so this is to draw comparisons between the systematic review and the regular narrative reviews. Yeah, sorry. So what is a systematic review is the application of strategies that limit bias in assembly, critical appraisal, and synthesis of all relevant topics or all relevant studies on a specific topic is basically systematic review. And it minimizes cherry picking. That means according to your or an author's vision, we do not pick up the articles. We try to pick up all the content which is present, which is answering the same question. We try to pick up that, whether it is published, unpublished, whether it is in gray literature, whether it is in thesis, all the data needs to be pulled in. And if it is in English or non-English, that also needs to be pulled in. So not performing a systematic review while answering a clinical decision or not taking in account of a systematic review decision can be very dangerous, and your clinical decision making can be biased. Okay, so basically systematic review takes all the research papers which are available to us, and the blue funnel is the systematic review team, which collaborates or which assembles all the data which is available. And then finally, one systematic review is published, which is basically collection of inferences of all the data which is present answering that particular question. So that means if we have a systematic review, we do not have to think anything again. So if we have systematic review, we can just, leave it and we can follow that systematic review, whatever it is written there, and we can take it as a final decision. This is what you would have made up by now. But the problem is that it doesn't end there. You need to critically appraise systematic review as well, because not all systematic reviews follow the gold standard. Okay, so what will you recommend, powered or manual brush? So this is like a QR code which you can scan and tell. I'll give you like 2 minutes. If you have, I can give the data that how many people think that they're going to recommend power brush or a manual brush or both or none of the above. So you can just do the QR code and let me know. Probably I'll tell you the answer at the end of, I'll have the answer right now with me. Are you able to scan the code? So once you scan the code, you can come across a form, and it can give you like questions which I have asked, what do you recommend? So there are, do you recommend powered brush or do you recommend manual brush? So I have like 10 responses, and out of those 10, 8 people say that they are going to recommend powered brush. Okay, let's see. We'll go ahead and see what is happening. Okay, so appraising a systematic review is very, very important. And this was a powered brush versus manual toothbrush for oral health, which was published in Cochrane, by Cochrane Library. And I'm going to appraise 2 systematic reviews. So the red one is the one, effect of oscillating rotating electric toothbrush on plaque and gingival health. It was a meta-analysis which was conducted by one systematic review. And now we have below the Cochrane review, which is comparing powered brush versus manual brush. So both of them are basically answering the same question, and both of them are systematic reviews. So the content of the systematic review is that it should have a defined question, it should have a finding, it should critically appraise the data which is given, and it should have synthesized those data which is available. Okay, so these are the contents. So first is what question PICO did the systematic review, did it have a PICO? My colleagues which are coming after me will definitely stress on PICO more. So PICO is nothing but a structured question which comprises of the population, the intervention, comparison, and the outcome. Okay, so we usually see that, and we will compare both the groups and see whether they have covered this or not. So we will identify the PICO. So here in the previous, the red color systematic review, here the patients are adults with mild gingivitis, so population is answered. Here the intervention is they are using a powered brush, that is an Oral-B brush which they are using, and they are comparing manual brush with the sonic brushes or any other brushes which are available. Okay, and the outcome is the number of bleeding sites after they do the brushing. What is the how the gingival status has improved. So this particular systematic review, the red systematic review, has also answered this question. Whereas if you go to the Cochrane review, each intervention or each group is explained very, very explicitly. So if you take the type of participants, it is telling we include individuals of any age or no reported disability. So they have explained the participant, very well. And intervention also they have explained. The outcome measures also they have mentioned. They have mentioned secondary outcomes also. So both the studies are mentioning PICO. So in this criteria, we'll give check to both of them. Both the systematic reviews are addressing PICO. Okay. So now, yes. So PICO both have answered. So in that particular criteria, I will give full marks to both of them. Even if the previous study did not have a complete paragraph on it, but it did explain the PICO very nicely. Okay. So then the next question is it unlikely that have they missed out any study? So for this, you have to understand that the search has to be very, very vast. You have to at least do 2 search engines search so that you can include all the possible data which is available. Okay, so then you compare, and is the finding of those studies published or not? That also you have to see whether both the articles are covering that or not. So when you see the green one, that is the Cochrane one, it is using almost 5 databases to get the studies. They are using Cochrane Oral Health, they are using the Central Registry of Control Trials, they are using Medline, they are using Embase and EBSCO. So they are using at least 5 search engines to collect all the possible studies which are available on powered brush or manual brushing. Okay, whereas if you look at the lower study, the systematic review, they are using Procter & Gamble Oral Care Clinical Archive for identification of RCTs from 2007 to 2017. So for any systematic review and to improve, I mean, gold standard says that to conduct any systematic review search, you need to at least have 2 search engines. And in the previous, the green one, they have done 5 search engines, whereas here only 1 search engine is search. So this is where the flaw of the second systematic review or the red systematic review begins. Okay. So where the criteria used to select articles for inclusion appropriate, did they explain the inclusion criteria and exclusion criteria properly or not? So in this, what happens whenever you have listed out the inclusion criteria and exclusion criteria, in a good systematic review, at least 2 or more independent reviewers are supposed to see the data which is present there and then decide whether it has to be included or excluded. If one person is doing it, then there is chance of bias and error. So that's why the study which was coded as red had only 1 person doing everything, whereas Cochrane reviews have at least 2 or more independent reviewers. And if there is confusion between those 2 reviewers, a third reviewer is selected to come to a conclusion. So the decision making is more robust in a Cochrane review than in non-Cochrane reviews. Okay, so the eligibility criteria was selected. If you can see, eligibility studies was listed out on both the things. Data were included from human subjects in the red study, whereas here it has been, as I told, the 2 reviewers independently did the search, independently came out with the abstracts, and then they sat together and decided, okay, these are the articles which we need to include and not include, and come to a decision making after that. Okay, so were the included studies sufficiently valid for the type of question? I mean, were the criteria for quality assessment defined, appropriate for the question, and was the assessment result provided or not? That is a major question. That is what makes systematic reviews unique. So Cochrane systematic reviews has a scoring system in which they code the articles in form of green, red, and yellow circles. And whatever each study has to, whatever randomized control trial you are taking, they will be assessed in terms of whether the data or random sequence generation was done, whether the allocation concealment was done, whether the blinding was done, where there was incomplete outcome data, where there is selective reporting, or was there any other bias. So each article which is incorporated into the systematic review is given a score, or it is critically appraised. So that is the gold standard for any systematic reviews. Okay, the quality of the evidence has to be told, that whether this particular study is of high evidence, this particular study is of low evidence, this particular study is of moderate evidence, and that will help you in your decision making. Okay, so the current Cochrane review always does this. It always has a critical assessment of each and every article properly, and they follow this chart in which they, whatever criteria is fulfilled, they mark it accordingly with green, yellow, and red circles. Okay. So were the results similar from study to study? That also you have to find out. If the results and the outcome is similar, or if they are doing it on the same parameters, so probably you can use the statistical data of each study, and you can pool it and then combine, do a meta-analysis and see which study fares better than the other study, which study's effect is more prominent than the other studies. So meta-analysis is the further part of the systematic review. So systematic review is mandatory, and meta-analysis can only be done if there are similar data, similar outcome present in at least 2 articles. Then only you can perform meta-analysis at 2 or more than 2. Okay. So meta-analysis is basically you calculate the best guess of the true effect size, and it is a statistical combination of all the results which are pooled together, and then you weigh them. Which study is having good effect, which study is towards the intervention, which study is against the intervention. That all you can analyze when you're doing meta-analysis. Okay. So this is how you do a forest plot, which will be taken up by my colleagues in the later subjects. So if a medical doctor or anybody comes to you, so a medical doc went to a periodontist for advice and he suggested for powered brush. So as a EBM practitioner, I will question that why is he suggesting that, and probably I should question the doctor that why did you suggest this. So this is an individual, and we are subjected to so many things in our life to come to an answer. We are having advertisements, we are having peers, we are having salespersons. Then there are other interventions like Ayurvedic, homeopathic, and allopathy also who are, who are influencing our decision making. So evidence-based practice is very, very important when you're answering clinical question. You have to ask a clinical question. You have to acquire the best evidence which is available to it. You appraise the evidence and then you apply the evidence. These are the 4 ways in you practice evidence-based medicine in your clinical or in your dental field. A systematic search strategy definitely helps. So if you have population with you, you have an intervention, you are comparing it, and if you are doing an outcome, then in those ways, if the search is done, then you will not have 15 lakh articles with you. You will have like 20 to 30, 40 articles pertaining to that topic, and then probably come to a right answer. So this is how a PICO is formed. Our clinical question is, among adults with gingivitis, does powered brush technique compared with manual brushing technique leads to better plaque control and less gingival pain? So P is answered, I is answered, C is answered, outcome is answered, and outcome 2 is also answered. Okay. So not all systematic reviews, as I said, are of high quality. Just a sec, the slides are repeated. So based on the studies which are available to us, the red color study recommends powered brush over the manual brush, whereas Cochrane brush, the Cochrane systematic reviews does tell that these benefits occur whether the brush is manual or powered. As the result of this review do not indicate the toothbrushing is only worthwhile when you're doing powered brush. So Cochrane review clearly states that there is no as such difference between powered brush and manual brush. And I will stress it again that the technique is more important. Okay, so the study which was done, which promoted powered brush was
स्पेसर तो नहीं पढ़ा हुआ कोई स्टूडेंट का मॉडल या कोई स्पेसर बना हुआ
I request the participants to mute their mic if you are not
किसको बनाना है
Dr. Shabina, can you please mute your mic, please? Yeah. So Procter and powered brush and manual brush, which promoted Oral-B brushes, was actually a study conducted by Procter and Gamble. So people can have their own interest when they're conducting systematic review. So it is very important to see that who is funding them. As I say that evidence-based medicine is a stage, and you need to follow all the 4 stages to come to this kind of inference. So whatever type of question it is, if it is an intervention type, you please first go to Cochrane library. And if you have a Cochrane review, your search is stopped right there. If you do not have a Cochrane review on it, then you please, search the database. And if there is a systematic review, you critically appraise it. And if it is good, then you have to stop. If there is no systematic review, then please go to the randomized control trials and see. Critically appraise those randomized control trial, and if they are well-written randomized control trial, then your search or your clinical decision making will be helped by those randomized control trial. If there is no randomized control trial, then you can go to PubMed central question area, and you see that if there are any other randomized cohort studies or observational studies or any other studies which has been done on it, and then you critical appraise it and stop. If there are no studies, then go to PubMed general database. You might find something, but you have to be beware of the inference which are done by these studies, and one cannot follow it. And you are following this evidence at your own risk. Okay. So general features of a Cochrane review is that it has a structured format, it has a detailed method section, it has a quality of clinical studies to be incorporated into a review, which are carefully considered, and you have team of people working on this. It is not one person's job. And it has to have multinational editorial theme to ensure that the review is applicable in different parts of the world. And reviews are always updated in a Cochrane review. In fact, we have a colleague of Dr. Saurabh Panda, who has a lot of publications in Cochrane Review database, and he constantly updates his review. So we know for that it is a constant process. Just by publishing Cochrane Review, you cannot sit every 2 years, you need to update it. So why Cochrane reviews are the gold standard of systematic review is that it is one of the single most reliable source of evidence on the effects of healthcare, and more than 1,755 protocols are registered, and all reviews are regularly updated. And Cochrane reviews are conducted with highest methodological quality. And the Cochrane library has many features that makes the finding of the information fast, accurate, and reliable. So if you have a clinical questions, first thing you should do is go to the Cochrane library, look for the answer, and if it is there, then you don't have to search anymore. Whatever evidence they are telling, it must be there. Okay. So Cochrane 2021 achievement is that, they have so many authors, which, 3,000 plus authors who summarize Cochrane reviews on, yearly basis. And impact factor of Cochrane is almost like 9.266. So it is like gold standard of evidence. And in COVID time, the Cochrane provided lot of information, which not only helped health workers, but it also helped many, public people who had access to this information. And it has 17 national regional license, and Cochrane India network is also trying to disseminate this information in local languages. So our reach is far and wide. And with this, I hope that I'm able to emphasize that why Cochrane reviews should be practiced in your daily clinical practice, and it should be a part of you. It is not like Google. If they have answers, it is well thought, well methodological data has been used, and they follow a strict protocol. Hence, if we have answers in Cochrane review, we do not have to look anywhere else. So with that note, I thank Dr. Meenu, Dr. Kusum for giving me an opportunity. It was a vast topic. I hope I have not rushed through it. So thank you so much. And these are my contact details. If you need any more information regarding Cochrane, you can always get in touch. Thank you so much.
Thank you, Laura, for that wonderful talk. And I'm really updated on, about the mechanized toothbrush and the other toothbrush. And very, very appreciative of you to bring out Paul Glasio's chart, how you follow evidence, when to stop looking for evidence. And your talk is now open for comments and questions. It was a very evidence-based talk, I would say. We can look at the chat box if there are no.
I just want to add a comment to Dr. Laura's presentation. As she mentioned, the systematic reviews which are published in Cochrane are updated every 2 years. Nowadays, Cochrane has given a new term. It is called as living systematic reviews. So we can very well say that the plain reviews are dead reviews, which gets over when they are published, and it can only the evidence is not updated. While a Cochrane review, as the evidence is updated as and when the evidence comes in, so it is known as a living systematic.
Yes, I think that's a very important point you've made, and especially during the COVID days, when so many reviews were coming and so much research was happening, especially they did it for COVID vaccines. We set up a living review because every day a new trial would come up and which would change the previous results. So for every evidence, like update software, which used to do Cochrane reviews earlier on, it was called update software because you're supposed to keep updating your evidence very, very frequently. But we have seen that happen in Cochrane, that not all reviews are being updated so regularly. So I think shifting to living reviews will be very, very important. And we can make use of certain search engines which can be linked to Cochrane review, and they can keep advising us, yes, a new trial has come up and now it's time to update a review. I think Covidence also provides that kind of service. So there was a question, how to select search words or keywords regarding a topic. Is there a systematic way to select keywords or any other to search regarding that topic? I think we are going to have a talk by Dr. Pranita Pradhan, who's our information specialist, and she's going to tell you how to search. But Laura, if you want to answer this question in your own way.
This itself is a presentation on its own, and I'm sure the speaker is going to do full justice to it. So
Yes.
me explaining in 1 or 2 lines is not going to help. So we will wait for the speaker information specialist, because I think they give the right answer, and they would be able to provide correct information. But as just one line, I would say that the word, whatever you're searching, you need to, the keywords are divided into 4 components. And under each component, you have to find the best possible synonyms which are available of that particular keyword. So if it is like gingivitis, it can be like bleeding gums, or, it can be like a lot of probing depth or something like that. Whatever leads to that disease or condition, those can be added as synonyms. So I will leave it to the speaker who's coming after me, or information specialist. She will give the correct answer.
The difference between systematic review and meta-analysis?
Okay, so systematic review is like qualitative analysis, where you see whether the article is good, bad, and systematic review is mandatory even for the meta-analysis to be conducted. Whereas meta-analysis is where you collect the data, the statistics which is present in individual article, you pull it together and you find out what is the size of each of these data and what is their effect. And you plot it onto a forest plot and then observe. So that will be taken up by Dr. Saurabh, I guess. Or
yes, I would say that systematic review is the all-encompassing review, including meta-analysis, which is also a part of systematic review. Not all systematic reviews will contain a meta-analysis, but wherever there is data which can be analyzed and turned into forest plots, that's where meta-analysis will be there. So meta-analysis is actually a part of systematic review. There is another question, if there is no change in the results of the review, is it still necessary to update the review every 2 years?
Okay, that is a good question. So the updating concept is only present, I think, with Cochrane, and other non-Cochrane based databases do not even follow that. So for Cochrane, if there are no studies, then also I think the authors have to write that there are no new studies which are available. Hence, the previous evidence is taken, or previous evidence inference is taken as a final. And Saurabh, if I can just interject you, like, for how many years does it stop? Like, if there is no more studies, then when can you stop updating?
No, there is no stop to that. Like, you just have to randomly go and search for new evidences which are coming in. And if there is no evidence, as you said, you can just have a conclusion that there is no more evidences which has come in, and you just have to give the conclusion update.
So it's important to do a search, and only then you can know that there is no fresh evidence. And change of the results you will get to know only once you have added those trials to your previous studies. So you will have to add up those studies and see whether the strength of evidence is increasing or decreasing. So that would have to be added. So whatever evidence comes up, if it is meeting your inclusion criteria, and if it is quality-wise good enough to be included, then you have to include, and that will be the most updated version, which is always required. Then there's a question, what does grey literature exclusively consist of? Or what are the type of search engines or any other sources can be included in the grey literature? Laura, would you like to say something about grey literature?
Yeah, although the search will be taken up by the colleague, but I would like to tell you that grey literature is nothing but all the data. It can be like documents which are published by the government, or theses which are published by the students who have not yet come to in a manuscript format. You can go and search their repositories and get the information from there. And there is a grey literature database which has to be searched. The information specialist would definitely be throwing light on it.
Thank you. What is your take on systematic reviews on in vitro studies, which doesn't come into Cochrane reviews, as many dental research is in vitro based?
Okay, so I do a lot of this. So yeah. So if you just go to like in International Endodontic Journal, they have listed out the guidelines of doing these in vitro systematic reviews, especially in the dental field, because we deal with a lot of dental materials, and the criteria which are based by them are excellent. So in case if you are someone who is looking to do in vitro systematic reviews, please follow those guidelines which are available in International Endodontic Journal. It's open, it is free for everyone. You can access it, and you can actually do systematic review of in vitro studies. They have been very, very helpful in understanding the material aspect and how the material is behaving in different conditions. So it is also important. But yes, Cochrane reviews are basically for randomized control trials, and it is meant for, they are considered to be the highest form of evidence. So they do not include in vitro studies at all. It's not their lookout.
I think we will stop discussion on this particular topic now. A lot of questions will come up subsequently also. So Dr. Kusum, Dr. Ashima, would you like to make any comments on Laura's talk?
So I guess it was a wonderful talk, and she tried to cover most of the things in a very simple manner. So,
please focus on Dr. Goyal, please. Okay. Okay, we will then move on to the next talk, and Dr. Kusum, please make an announcement.
Thank you, ma'am. I think Professor Ashima Goyal and Professor Laura Mishra has given an enthusiastic start to our workshop, and the participants seems to be eager to listen to our next speaker. We have Dr. Pradanya V. Kakodkar for our next speech. That is the topic, purpose of Cochrane oral health systematic reviews. Dr. Kakodkar is an independent research consultant. She has completed her MDS in public health dentistry. She is a passionate national level trainer for the systematic reviews and bioethics, as well as for the manuscript writing. She was instrumental in initiating systematic reviews as library dissertation for the dental postgraduate students. I welcome you, Dr. Pradanya. Over to you, ma'am.
Thank you. Do I have the permission to share the screen?
Yes, ma'am. We have made you the co-host. I think you can share your screen.
Okay. Yeah, can you see my screen?
Yes, ma'am. Visible now.
Thank you so much. Good morning, everybody. Respected Meenu ma'am and all the other speakers at this event today. First of all, I would like to thank Dr. Meenu Singh ma'am, who is my mentor when it comes to systematic review, and one other person is Dr. Anju Sinha at ICMR. It was the article by Dr. Anju Sinha titled Building Capacity for Indian Scientists to Do Systematic Review in Pediatrics, which was published in 2015. It was that article which initiated interest in me to look into this topic, and that's how my journey began with systematic review. Dr. Ashima Goyal, ma'am, has already set the stage by giving an introduction into the priority topics of Cochrane review, and Dr. Laura has further explained the differences between non-Cochrane and Cochrane review. So for me, the title given for the session is Purpose of Cochrane Oral Health Reviews. Before I really go into the topic, let me give you a scenario or a situation. Okay, so I set out to buy sports shoes for myself, and I have variety which I can see in the market. But end of the day, I settle or I buy the Nike shoes. The tagline being just do it. So what is it that made me buy this Nike shoes, or why is this brand standing out from the rest? So you will believe me and you will be with me when I say that it gives me comfort. It has a good quality. It is trustworthy. The brand is trustworthy. It is having credibility. It has shown proven results and it is trendy. So given these things, the purchaser or the buyer would like to go with that kind of a product which is giving them quality and which is giving them all other forms of advantages. So with this background, I go into my topic, and it will be covered under two broad headings: introduction, which will have background, goal, scope, stakeholders, and purpose of Cochrane Oral Health Review. And secondly, evidence, priority review, priority collection, podcast, translated review and podcast, plain language summary, and blog shots. So if I start with this introduction to Cochrane Oral Health, it is one of the groups under Cochrane Group. Cochrane is having nearly 50 plus different groups, and Oral Health Review Group being one of it. It is having 1,600 members and over 900 review authors from 40 different countries. And all these authors contribute in different forms. That is, they help in preparing of systematic review, peer reviewing, translating articles, and offering consumer output. The Cochrane oral health activities are coordinated and supported by the editorial-based team located at the Division of Dentistry, the University of Manchester, UK. This is a very important slide where I would explain what are the goals of Cochrane Oral Health Group, Review Group. So goal 1 is to produce trusted evidence. What would you mean by a trusted evidence? It means that to produce trusted and timely synthesized evidence addressing the most important question for health and for care decision making. So we got to believe in Cochrane Oral Health Review because it produces trusted evidence. Goal 2 is about advocating that evidence. To be a leading global advocate for evidence-informed health and care. So once systematic review is done, the next work is to advocate that work so that people use it. So second one is advocate. And third one, informing health and care decisions. To inform health and care decision by making our evidence accessible, usable, and available to all. So if you see broadly, Cochrane Oral Health Review serve 3 purposes. First one, prepare a trusted evidence. Second one, advocate about that evidence. And third one, to make sure that the dentist or clinicians or the stakeholders make use of it for their decision making. So Cochrane Oral Health, what does it do? What does this group do? They produce high quality, priority, relevant, systematic reviews. So Dr. Ashima Goyal has already told us about this priority systematic reviews in the area of prevention, diagnosis, treatment, and rehabilitation of oral, dental, and craniofacial diseases and disorders. And they also actively take part in disseminating this information. So who are the stakeholders? Cochrane Oral Health Group caters to which stakeholders and what are their roles? So if you know about this evidence-based practice, we all know it is in a form of a triangle. So there is a patient, there is a clinician, and then there is an advice, or there is a literature evidence. So if you know the evidence-based pyramid or the triangle, we need systematic reviews to back the literature based on which the dentist is going to make his decision for the patient. The patient's complaint, the patient's values, combined with the literature evidence and the clinician expertise put together, make a clinical decision for the disease of the patient. So if you look at the list of the stakeholders, they are the clinicians who need this review to make a clinical decision. There are the researchers who need to know which area is left untouched. Systematic review will give them an idea which area needs to be researched. The policy makers, whether they need to have the knowledge of this review because they have to make a decision whether to fund a research project or not. Guideline developers who will make decision for the community health, so they need to know about the review. People with oral conditions and their caregivers. So let me tell you, Cochrane Oral Health is not only for the closed group of clinicians and the medical and the learned people, but it is also for the common people and the caregivers who can read this findings of the review and make use of it, and members of the public. So it's open to everybody. So Cochrane Oral Health Review is going to help all the stakeholders to make a decision. Now coming specifically to the topic of purpose of Cochrane Review. So with the background that I gave you initially, that we need or we normally choose something which is high quality, which is standardized, which is having a trusted evidence, which is having credibility, where there is a priority, and it is up to date, trendy, latest. These are the things which we look at when we want to buy something or when we want to use something. So Cochrane Review is, all these qualities are applicable to Cochrane Oral Health Review. The Cochrane collaboration is an international, not-for-profit organization that aims to help people make well-informed decisions about healthcare by preparing, maintaining, promoting the accessibility of systematic review of the effects of healthcare interventions. So when you can see that Cochrane Oral Health Group not only generates trusted evidence, but it also advocates and it helps the clinicians that by making it accessible so that they can use it for their clinical decision making. Coming to my second part, evidence. What kind of evidence is generated by Cochrane Oral Health Group? All the evidence that is generated in the form of reviews, updates, and protocol is all available in the Cochrane library. Also, there is a Cochrane database of systematic review which publishes the systematic reviews. So the different evidences which is created is made accessible to all. Now, let us see point-wise what is this different kind of evidence and what are the priority areas. So oral health titles for review on priority. So let me take you to the site directly. I'm taking you to the site. So this is Cochrane Oral Health, and you can see the heading priority reviews. So here at their site, you can see that they have given a list of topics which they are interested for you to generate systematic reviews. And Dr. Ashima has already told us how they have come out with this priority areas. So look at these. When you go to the site and you can spend time scrolling through the topics, some topics which interest you, like oral hygiene care for critically ill patient to prevent ventilator associated pneumonia. This was published in 2016 and today we are in 2022. So this is a likely area which you can take for your systematic review. So
Sorry
let
to
me,
interrupt you, ma'am. We are
yes.
not able to see your screen. I think you are sharing the website.
Yeah, so you can't see it?
No, ma'am. We are just able to see the PPT or your presentation you are sharing. Not able to see the website.
Okay. Can you see now?
Yes, ma'am.
You can see it?
Yes, ma'am.
Yeah. So I'm sorry about that. I was telling you that I'm taking you directly to the Cochrane Oral Health website, and they have given this priority reviews, and they've given a list of reviews which they want you to undertake. See, suppose this one which was published in 2013. Primary school-based behavioral intervention for preventing caries. This was done in 2013. So today we are in 2022. So this title has a greater chance of being selected if you submit a protocol proposal in this area for a systematic review. Going further, screening programs for the early detection and prevention of oral cancer. Again, it was done a long time back. Then there is one topical fluoride versus another, preventing dental caries in children and adolescents, done in 2004. So you can spend time on their website to identify the topic which you think you can do. And then there are some topics also which they have told that they would not like to take it up actively. Suppose topic like how can oral cancer be prevented? The decision is we will not actively work on this topic, but we recognize it as a priority topic. So they have given a table wherein they have said which topics are a priority to them and which topics are not a priority to them. So, okay. Let me go back to my slides. So Dr. Kusum, you can see my slide now?
Yes, ma'am.
Yeah. So I was just explaining, so which are the topics of priority for Cochrane Oral Health, that list which you can get from their website directly. The second one is priority collection. Priority collection is Cochrane Oral Health Review Group has identified a priority group. The first priority, prevention of tooth decay and oral diseases in elderly population. So this is their priority collection title. What they're going to do is they are going to compile all the systematic reviews and the protocols and the studies which have been done under these title. So that is what they have called as priority collection. They are going to compile all these topics, reviews, protocols which have been done under this. This is their first priority collection. Okay. Apart from the systematic reviews that they do, as we know, they have three goals. One is generating evidence, second one is advocating about it, and third one is helping the clinician to make use of it in their decision making. So podcast. If you do not have time like half an hour, 45 minutes to go through the entire bulk of Cochrane systematic review, you can hear to a podcast. Podcast which is of a duration 3 to 5 minutes and which will give you all important, it will extract the important information from the systematic review and you can hear it as a podcast. Today, as we travel for work or we are sitting idle maybe for 5 minutes, we are taking a break, quickly within 3 minutes or up to 5 minutes, we can hear to a podcast, and podcast is giving you all the required information which is there in a systematic review. Isn't this a wonderful thing? Yes, it is a way for advocating and helping the clinicians. You at least hear to this podcast and you can help with the decision making. So you can see some topics. I've just taken some topics, and then there is a translated podcast as well. So this area is also there for us to explore for translating the available systematic reviews. Next, going to blog shots. Today, we are in an age where social media is the thing in our life. The morning when you get up, probably the first thing you're going to see is your mobile phone and the social media. So this is one other beautiful way of sharing your systematic review through a blog shot. So it is just this snapshot. Okay, this is a snapshot which will give you information about the title of the systematic review, what is the evidence that is generated, how many review articles and number of participants were involved in making the decision, how is the evidence, and if you want more, then a link is provided for you to really go and look into the details. Isn't that a real quick, trendy, trusted evidence coming our way through blog shots? So they have modified, adapted themselves to make it interesting to the newer generation and making use of the technology as well. So we have podcast, we have blog shots. Then we have this plain language summary. Because Cochrane Oral Health Review is not restricted to only those medically health science professionals, but anybody who wish to read it and want to apply it can go through it. And then there is this plain language summary. So when an author is submitting the systematic review, they are also submitting a plain language summary of their work, so that there is no difficult words from the medical which the common people would not understand. It is very comprehensive and simple, so that your work is put in the form of a summary which the normal person could also read. Okay, from January 2022 to March 2022, these are the systematic reviews which have been published by Cochrane Oral Health Group. Sealants for preventing decay in primary teeth, orthodontic treatment for crowded teeth in children, interventions for promoting the eruption of palatally displaced permanent canine teeth without the need for surgical exposure in children aged 9 to 14 years, orthodontic treatment for posterior crossbites, interventions for the treatment of oral cavity and oropharyngeal cancer, chemotherapy. So these have been published by the Oral Health Group from January to March 2022. Well, this is my last slide. And again, I would like to reiterate the purpose of Cochrane Oral Health Systematic Reviews. It is having a high quality, trusted evidence, credibility, priority topics are taken up, and it is latest and up to date. And if you are interested, you not only can contribute by doing or generating a systematic review, you can take up other things like making a podcast. You could take up doing a blog shot, or you could advocate this information to all the dentists so that they can use it in their clinical decision making. Because the goal is not only to generate evidence but also to propagate it into the community or among the stakeholders. Clinicians who are out of college several years ago may not be up to date with the literature, scientific literature. So you can very well help them through your podcast or by spreading the information about the systematic review. So this is the site oralhealth.cochrane.org, which will give you all the information about Cochrane Oral Health Group and the kind of priority topics that they are interested for systematic reviews. So you can all please connect to me on LinkedIn. I would be happy to share my experiences, and if there is any question, you could always write to me at pradnya.kakodkar@gmail.com. Thank you so much.
Thank you so much, Dr. Pradnya, for that wonderful talk. I was really impressed by your evidence-based medicine activities when you were in your department in Pune. And we know that you have done so much of academic work, and all your MDS students were at the time conducting systematic reviews as their dissertations, which itself was a great idea to promote evidence-based dental care. So thank you very much for your talk today, and we hope to continue to interact with you. I would now request, and this was just to compliment you, and I'll now request Dr. Ashima to make her comments, and other people to send their questions to Dr. Kakodkar. So as Pradnya, we have seen that people are doing systematic reviews. They've now started understanding systematic reviews, and some of them are also doing systematic reviews in India. We know that there are some who are doers and there are some who are users. So users are also a very important group, and they also must learn how to understand a systematic review and how to take that evidence into practice. And that is why now we have a very important discipline, which is called evidence-based clinical practice, or you can call it evidence-based dental practice. And how to promote that in a teaching institution or in a clinical setting where you want to take the best evidence to benefit your patients. So that is also something very important, and that's where I think the podcasts and the reviews and the Cochrane clinical summaries, all those things are extremely important, and so are plain language summaries as a part of Cochrane review, which tells the normal consumer about what they are supposed to expect from a particular intervention. So your views on that?
Yes, ma'am. Actually, we always feel that Cochrane Oral Health Group is only about generating evidence, but it is much beyond that. We also, even if you are unable to contribute by making a systematic review, there is ample of literature already generated by Cochrane Oral Health Group. So through this way of podcast and through blog shots, we can surely advocate advocate the use of this and also make them realize the importance of evidence-based practice, because clinicians is a very big number. Every year we have like 30,000 dentists coming out, major portion going into clinical practice, but say after 5 or 7 years they've lost contact with the academics. So to keep them updated, we have this different association, in Indian Dental Association in every state, and they also conduct once a month continuing dental education program. So if we promote the use of podcast or blog shots among these clinical dentists, then we are reaching to a large mass and also advocating for evidence-based practice with the use of the trusted evidence from Cochrane Oral Health Group. Because if we see the impact factor is 9.38, this impact factor should really jump and move up. And this is possible when the dentists realize that they should use it in their clinical practice and also cite it when they generate more information or more systematic reviews. So probably as the India Network Group, we could also generate this new goal to advocate this information to the clinicians. And firstly, we're going to do it for the academicians to make a systematic review, but important also is to advocate and make them realize the importance of using it in their decision making for their patient.
Thank you. Thank you very much. Dr. Kusum, if there are any questions in the chat box, you can have a look at them. Otherwise, we can wind up this talk and then we go to the next one. Or is there a break now? I think there is a break in between.
Ma'am, one more speaker is there. After that, we have it.
Okay. Okay.
Thank you, ma'am. Thanks a lot for an enlightening presentation. Our
Thank you,
speaker, thank you, ma'am. Our next speaker is Professor Balendra Pratap Singh. He is professor in Department of Prosthodontics, KGMU, Lucknow. He is also director of the Cochrane India Affiliate Center, KGMU. He has published 85 publications, including 6 Cochrane meta-analysis, and he has delivered various talks in the international conferences like USA, UK, Italy, etc. A very warm welcome to you, sir, and over to you.
Thank you, Dr. Kusum. Thank you so much. And I am privileged and honored by Dr. Meenu Singh, who is the co-chairman of this Cochrane India Network. Am I audible?
Yes, Dr. Balendra.
Yeah, thank you. And thank you so much for giving me an opportunity to share my thoughts about this Cochrane Oral Health Trial Registry. Is my slide visible?
Yes, sir.
Yeah, thank you so much. So, thank you one and all, and welcome to this, I think, first Cochrane India Network workshop on dentistry activity. So, my topic, which is allotted to me, about the introduction about the Cochrane Oral Health Trial Registry. And I would like to disclose that I have taken few images from different websites and do not have any financial conflict of interest to disclose. But yes, I have taken a few screenshots from my Covidence meta-analysis, and these are my others disclosure of conflict. As we all know that, I think most of the listeners here are actually they are very much interested in Cochrane review. But when I discuss with my resident and few more colleagues, they do not have so much experience, and they know about the Cochrane, but they actually do not have so much experience what is actually systematic review and what is the importance of that. And I think now with this workshop, they are able to understand it, it very well. So let me summarize few points, which may be a repetition in my presentation as well, but I think that will be better to understand Cochrane review in a much better way. So we all know that primary research means P means patients. or in vitro studies. That means primary research which involve patients or which is done in the laboratory like in vitro studies. It can be of various types. It can be of experimental research. It can be doing a survey in a society or in a village. It can be a questionnaire survey, which can be done in a hospital-based setting or a community-based setting. So these are all primary research. We, in a thesis, generally do primary research, which can be in vitro, which can be in vivo. On the basis of these primary research, on the basis of finding of these primary research, we can generate secondary research. So for the secondary research, we need a particular type of study. Say, for example, if we would like to write a systematic review about the best preventive methods for any disease, then we have to find out the studies which are randomized controlled trial or prospective study, mainly a randomized controlled trial. If we want to write a systematic review on diagnosis, like which is the best method to diagnose dental caries, or which is the best method to diagnose temporomandibular disorder, then we have to find the studies which are RCT in nature or cohort study. So this way, we have to define what is the typical type of therapy, a typical type of treatment that we want to explore in our systematic review. On the basis of that, we have to find out these type of studies as well. Say, for example, if you would like to know about the etiology, then we have to find out the cohort studies on that topic as well. On the basis of these primary research, we can generate secondary research. Secondary research do not involve any patients. This only involves the human, computer, and then the available literature from the internet. That means if somebody have a limitation of doing research, like they do not have a patient or they do not have a... Am I audible?
Yes, sir.
Okay.
You are audible.
So for the secondary research, we only need a human being, computer, and the available literature. So this is very important. If somebody have a deficiency in the infrastructure or do not have or limited access about the patient, then that person can involve himself or herself to write secondary research, which is actually an original article as per the National Medical Council. Say, for example, now, I would like to know what is the best treatment for the myofascial pain in temporomandibular disorder. So we all know that prevalence of temporomandibular disorder is too much, around 2 to 5% in the population. And we want to know which is the best available treatment for the myofascial pain, whether it is occlusal spin or a laser therapy, or it can be anything else. So what happens if we search in PubMed or in DASE or any other database, even the Google Scholar, we may find article. This is the article type 1, which actually give the result that pain is significantly reduced in laser therapy than the occlusal spin therapy. But if we go and find another article, we may find that pain is significantly reduced in occlusal spin. And in third article, we may find that there is no significant difference in both the treatment. That will create a lot of confusion in our mind. If I read only the first article, then I start giving laser therapy to our myofascial pain patient. If we are able to get only the second article, then we start giving the occlusal spin. So this is where systematic review comes, the role of the systematic review comes. So now what happened? What the systematic review is, we have to find the studies of A, B, C type, like the study ID that I mentioned here, in different databases. At least 3 databases is important. Central, which is a database generated by PubMed, by Cochrane, and also the PubMed and MBase. PubMed is actually US database generally, and MBase is European database. So these 3 databases is actually mandatory for non-Cochrane review. But for the Cochrane review, these 3 databases, apart from other trial registries, also very important. When we find different types of studies from the database, then we combine these studies together quantitatively as well as qualitatively. So qualitatively, we can check the risk of bias and all these things, and quantitatively, we can measure the we can develop the forest plot, and then we can understand. So this systematic review is actually this combining of different types of studies having different types of outcome, maybe beneficial, maybe harmful. And this combining is known as systematic review and meta-analysis. So a systematic review synthesizes the result of all available studies. All available studies means which are available in the internet as well as which are available in, like in a physical form, not available in the website. That is called the grade literature actually. So we have to combine all these studies together, and then we have to find out the strength and weaknesses in each and every study. And then we have to give summary of that and present to the audience or reader, so that those who do not understand meta-analysis, the terminology and the statistic, they can very simply and easily understand what is the finding of after combining all the studies together. So as we we just saw about this pyramid, that the clinical reference text case report have a lowest level of reference because there is lots of bias in that. Say, for example, for the case report and case series, if I have so much experience in making complete denture, I will be able to make a good quality complete denture. I will be able to communicate with the patient very easily. I can understand the psychology of the patient very easily, but the newcomers may not. So if I say that this type of complete denture is very important in this type of patient, which may not be applicable to all of the humans, those who are completely dentures. So this way, because the bias is more at the lower portion, like case report and randomized control trial, cohort studies and case control, that's why the quality of evidence is low in comparison to Cochrane meta-analysis. So these are the different database where we can search the primary studies. That means primary research, which can be PubMed, Embase, Scopus, Google Scholar. But most of the journal which publish the non-Cochrane review need at least 3 databases: PubMed, Embase, and Central. Embase is paid, PubMed and Central is free, and the subscription of Embase is quite heavy. So this is about the primary study. And for the secondary research, we can go for the Cochrane library, which is the best. And on the basis of secondary research, generally the guideline will be developed. So Cochrane library is a collection of different databases, which includes the Cochrane reviews. The name of the journal of the Cochrane is Cochrane Database of Systematic Reviews. This is popularly known as Cochrane Reviews. Cochrane Library also published the abstract of systematic review, which is published in other journals, non-Cochrane journal, you can say, like Journal of Prosthodontics and Journal of Prosthodontics or Journal of Dental Research, like these. Cochrane also have a central database which actually combine or actually import all the randomized clinical trial and quasi-randomized clinical trial from PubMed, Embase, grade literature, and from wherever they can get to the central, so that people can search only on the one portal rather than going to search in a different portal, PubMed, Embase, Scopus, Google Scholar, and each and every place, because they have a different search system to search. They have a different filters. They have a different keywords. Like PubMed have a mesh keyword, Embase have entry. So that is very difficult for the beginners. And Cochrane actually do not have to search these databases. You have to just refine the keywords. They will give a keyword list, and the search system, you have to refine it. And then Cochrane actually run the search and give you all the articles. You do not have to do so much. You do not have to involve in so much technical team to the different searching of the different databases. Cochrane also provided a health technology assessment database known as Health Technology HTA, very common, and that is also one of the important feature of that. But today we will concentrate upon Central actually. So Central is actually a collection of randomized control trials, systematic review, and clinical answer. And there are so many things, but for the beginner and for the even randomized control trial and systematic reviews, very important. And it is actually maintained by Cochrane Oral Health Information Specialist at the Victorian Place in UK. Central contain randomized and quasi. Quasi is what? Quasi is like if any study recruit the patient on the basis of like the OPD days, which can be easily so that evaluator or optometrist can easily guess the chances of particular type of intervention. So quasi is actually, you can say, false randomized control trial. But sometimes we have to include quasi randomized control trial in Cochrane as well. So this central database actually includes PubMed, Embase, SynHealth, the Chinese database, clinical trial, WHO clinical trial registry platform. So if all the clinical trial registry, the important clinical registries, the articles from this clinical trial from this is in the central database. This is the screenshot of Cochrane library, where you can find out different types of content which is present there. Like you can find out that 8,800 Cochrane reviews. The trial is around 18 lakh something. Trials means only randomized control trial and quasi-randomized control trial. You will not find any cross-sectional studies, in vitro studies, observational studies. No, you will find only the trial, randomized control trial and quasi-randomized control trial. So it's the largest collection in the world about the RCT. You will also find the Cochrane protocol here and a few other things like clinical answer and all these things. What you can do is you can search, like I tried to search about the temporomandibular disorder, and then I found here you can type temporomandibular disorder and click the alt text, and then we found about 38 Cochrane reviews about the temporomandibular disorder, 10 protocols. The protocols will actually just a step before the Cochrane reviews. So first you have to submit the title, then title registration form. After the approval title registration form, you have to go for the protocol, and then it will be reviewed, and then Cochrane review will come. So for the temporomandibular disorder, you can find what are the different types of Cochrane reviews are present, and then you can find the different types of trial which is present in the Cochrane database, which is known as Central. You can just use different types of filter to find out, like in 2022, there were 112 articles, 21, 149. This way, you can also guess about what is going on in the scientific field. If more and more trial is coming, that means this topic is burning. If it is not, that means the topic is like not so much important to the public. So you can use filter for that. You can also use like the last 3 months, 6 months, and from the different databases, the center has imported all the references like PubMed and Base and clinical trial. So this way you can find out different types of clinical trial. When I entered about the temporomandibular disorder and occlusal sprain, I found like only 7 Cochrane reviews and 268 trials. So this way you can use different types of filter using the Boolean operator, and or not. And I think Pranita will cover it, like very big day, so that you can very easily understand about that. So these are the Boolean operators which we have to use in different databases, PubMed, Embase, and Scopus, and Central. And we have to technically need training about that to find out the exact article. There are lots of filter as well, and there are niche keywords and so much and so on. So we have to understand that. This is the Covidence platform, where after finding out the studies, when we search in the different PubMed and Base database, we have to find out the studies, and these studies will actually exported and then imported into the Covidence software. This software will actually help to screen the studies. So these are the steps of systematic reviews. Like for this occlusal intervention for temporomandibular disorder, almost all the articles which you find from the central and all the database were imported into this software, and then this software automatically remove the duplicates which are actually found in PubMed and Embase as well as like this. So they will remove the duplicate, and then we have to go for the title and abstract study. That means we have to include or exclude the studies on the basis of reading title and abstract. And then after inclusion of the article on the basis of title and abstract, we have to screen the studies by reading the full text of the article, so that to find out whether that particular study is suitable for our Cochrane review or not. And then we have to do the data extraction. So this way, studies get reduced a lot, because if we say, for example, import 2000 study, then almost after reading title and abstract, we will only found 300 or 400, or maybe even very less, maybe 30 or 40. And then we have to extract the data. So for example, for the title and abstract screening, this is the team progress. You can find we have to, two people have to screen title and abstract separately without discussing with each other about particular type of study to reduce the bias. So, and nobody, and both people cannot able to see the decision of particular type of randomized control trial, whatever he or she has decided. So this way we can check the team progress, but we will not able to see the decision of the other person. And then after screening the title and abstract, we have to go for the full text review. And then again, the full text is separately reviewed, screened by the two reviewer, so that, and then we have to resolve the conflict, if any. And if conflict is not resolved by the two person, then third person have to come into place and resolve the conflict. And now come to the steps of systematic review. So searching of these studies in the central of PubMed or Embase, command this step here, searching the studies. Because first we have to register. For the Cochrane review is fine, because Cochrane protocol is different. But if it's not Cochrane protocol, you can go for registering Prospero. And then we have to search the studies. And after searching the studies, we have to screen the studies in Providence. And then each and individual study, then we have to export all the data extraction into the Redman and do the statistical analysis. And then Redman also help in writing the systematic review and meta-analysis. So on the basis of that screening and all these things, if there is any disagreement, then third author have a role to play, and that author will actually help taking a decision. And this evidence is actually free for Cochrane review and paid for non-Cochrane reviews. But you can write it down, you can write an email, and for the developing countries, they make it you free. For the data extraction and management, we have to go further. I will not go into the detail of that, but let me summarize with one slide only. The data extraction, we have to prepare a data extraction form for each study. The data extraction form which is same for all this, but the headings should be same, and which includes actually the characteristic of the study. That means what are the types of participants. Say, for example, we have to mention the type of classification for TMP, like whether RDC TMP, ADC TMP criteria, what are the type of approach, what is the age of the patient, whether the male is included or only the female, or both genders, what is the age, then what are the other socioeconomic status, so that later on, if we find different results, we were able to define where there is a difference, which we called it heterogeneity. And we have to define and find out the intervention, whether the occlusal sprint is given for 12 hours, whether the occlusal sprint given for 24 hours, and what is the duration of laser therapy, what is the wavelength of the laser therapy, and all these things. So we have to define each and everything in data extraction form. And for the qualitative assessment, we have to go for the risk of bias assessment. And there are 6 domains for the risk of bias assessment for the RCT. And then we have to resolve the disagreement if there is any conflict. Now I would like to cover a few advancements about the systematic review which Cochrane is going on. Like they have given the living systematic review guideline, they have published that. And living systematic review is, that whenever some article RCT will come to the PubMed or Embase database, then it will automatically, of course, the human interference must be there. Then they will export the statistical values, and this way they can help in writing a living systematic review. Few living systematic reviews are already published in Cochrane, I have seen that. So this is the newer thing that is going to happen, and we have to easily adapt with that. Otherwise, we would be backbencher at that. So we have to do that also. And networking analysis is, of course, like when there are lots of intervention, then we have to combine it together and to find out the best evidence, because in simple meta-analysis, we can only combine 2 interventions, but there you will find that there are lots of intervention. So do not know like which intervention is better than this and that. So network meta-analysis comes into picture. So these are the 2 newer things, or the field where we have to be expert, we have to take expertise in that. So thank you so much for your patience here, and thank you one and all. Thank you, Meenu ma'am, for giving an opportunity to me. Thank you.
Thank you. Thank you, Dr. Balendra, for such an informative talk. I know for many of the beginners, it must be now getting a little complicated when we are talking beyond some of the basic concepts. So, but I think they have to now understand, they can attend some of the basic Cochrane workshops also, in which there is some introduction, about what are the components of Cochrane as library as well as an organization. But Dr. Balendra, you have really put everything in a very good perspective for everybody to understand how Cochrane evidence has to be used and applied to clinical practice. So if there are any questions or comments, Dr. Balendra will be happy to understand. I don't find many so far, except that Vivek has sent a Google form for filling up for the feedback for all the talks which have taken place till now since the morning. And we will have a similar form done at the end of the workshop also. Dr. Balendra, how do you feel we can popularize Cochrane amongst the medical students or the undergraduates, say BDS students or MBBS students? What do you think should be the strategy used for popularizing this type of approach?
I think we have to, first, what we have planned is, we will actually, I think there must be our orientation session to them. And then what are we have to give summary of important Cochrane reviews of the clinical questions. This way, they can actually understand what is importance of Cochrane reviews and what is this Cochrane review actually, because many people still do not able to understand what is this Cochrane. They know the name, but they do not understand what is this Cochrane review. And this way we can popularize immunization, because then they will go for the higher education. They can able to understand, and they can do the dissertation topic. They can choose dissertation topic in the form of systematic review, so they can understand. They can later contribute for the topic.
As you know, these days NMC, that is National Medical Commission, earlier was Medical Council of India. They have put in the curriculum for MBBS graduates, right in the beginning of foundation course, which includes professionalism, ethics, research, etc. I think that is the place where we should have a place for introducing evidence-based practice, and then automatically Cochrane comes into view. So I think we should follow some of this type of, approach for including this. You could actually do it for the Dental Council of India. Is Dental Council of India still separate from NMC, or it comes under NMC?
I believe it is separate from NMC as of now.
So I think you should maybe take it up. Dr. Ashima, if you have any comments to make on this.
Yeah, Professor Meenu, right on this, I have a suggestion that initially for the postgraduates, we used to have a thesis and we used to have a library thesis. So instead of a library thesis, if for the whole batch, like we have either 2 or 3 in one, or maybe in other dental colleges, we have lots. So at least 3 can be given one topic of systematic review or a scoping review. And then, all the steps, what we are just discussing today theoretically, they can actually do practically and come out with a good systematic review over a period of 3 years along with their thesis. So they will be able to do both the primary research as well as the secondary research and learn a lot about it. And we are already doing it at PGI in our department. And so this is a suggestion for other dental colleges to follow as well. So since we have discussed quite a few priority areas today, so in the beginning, right in the beginning, here at PGI, we are taking little more time to give or submit our protocols. If you can do it within the first 6 months, give them a topic and they can just do it and finish it and learn about it, and under the expert guidance of their professors as well as people who are actually doing it, I'm sure they'll be able to do it, in a good way.
Yes.
Ma'am, I would also like
Thank
to
you. Yes, Dr. Lord.
I would also like to add, and I agree with Ashima ma'am. Yes, ma'am. Like your institute, there are other institutes in South as well as my institute, and who are part of the Cochrane India network team. At least their students are doing instead of library visitation, they are doing systematic reviews, and it is completed. The protocol registration and everything is completed in first 6 months. I also feel that even faculties as well as the faculties also need training, because if they are trained, then only they can train the students. So this has been already suggested to the Dental Council of India, and they have also agreed on this. There are preliminary discussions which are on, and hopefully it will not be made mandatory for everyone, but it is a proposal that you can do this as well. Give them an option of this as well. And it is a part of faculty training program that the proposal has gone from a lot of colleges to Dental Council of India.
Dr. Vijay Lakshmi from Maharashtra University of Health Sciences mentions that they have already implemented this, and I guess Pradnya also had implemented this in D.Y. Patil University, where the students were doing systematic reviews. If any one of you want to make a comment, you're most welcome.
Ma'am, can I add to this?
Yes, please.
Ma'am, since 2015, we had started training the postgraduate students to undertake systematic reviews. So for 3 consecutive years, we had asked the entire batch to do. And then from that experience, we realized that some are not very academically oriented. So then after 3 years, we gave them a choice. If somebody wants to continue systematic review, they are free to choose, and the others can take up narrative review, because ultimately systematic review needs a little more hard work and effort, and we also needed a good library support, because this entire process of systematic review is based on the literature. So we were also finding some difficulty with that part. If we did not have good literature coming in, then we were not able to deliver a good systematic review which was ultimately published. But overall efforts are being conducted among the dental colleges to take a systematic review as library dissertation. It is happening, and faculty is also being trained. So capacity building efforts have also started.
If we make it compulsory somehow, can you please hear me? If we make it compulsory somehow, so then all these problems that we are facing, would be taken care of. If something has to be done, it has to be done. Right? So the library problem, or if the faculty is not trained, they'll see to it that they get trained. They have to get trained if they have to teach the postgraduates, isn't it? So they would attend workshops like this, and they will, imbibe everything, before a new batch comes. They can keep updating every year. So I'm quite sure that, gradually, we should actually not wait for DCI to tell us anything. It can be at our own level that we start, and when something becomes compulsory from their end, then in any case, we have to do it. But let's make it compulsory at our own institutes. We are saying one whole batch takes up one systematic review, and divide the work right in the beginning, and there can be n number of authors, and we can do it. I personally feel it like that.
I think you are very right. Thank you, Dr. Ashima, for your learned view that you don't have to wait for DCI. You have to start like many universities have started, and PGI is also doing this. So I guess this is something which is implementable. And like you can give topics to 1 or 2, offer systematic review to 2 people, and they can be mentored by the faculties, a couple of faculties, and 4 or 5 would make a very nice systematic review group. So I think that is something which is doable. And as Pradnya had said, just do it. So that is something which I think we must take into account. If there are any more comments on this, welcome. Otherwise, I'll request Kusum to go with the program.
Thank you, ma'am. Thank you, sir, for a nice presentation and a very,
Thank you,
very
sir.
active session. I think now it's time to take a 5-minute tea break because we all are, listening all the information since morning. So we will be right back after a break of 5 minutes. And
Yeah,
our
we call it a mobility break because if tea is not available, just move around. Thank you.
And our next speaker after the break will be Dr. Saurabh Panda.
Yeah.
See you after 5 minutes. Okay.
And don't forget to, fill up your form. Fill up the Google form which Vivek has circulated in the chat box.
A report card, basically.
Yeah.
बंद राजा माइक तो मूडी राजा क्या
Hi, good afternoon. Welcome you back. Our next speaker for the workshop is Dr. Saurabh Panda. He is presently working as Associate Professor in Department of Periodontics and Oral Implantology at Institute of Dental Sciences, Shiksha Anusandhan University, Bhubaneswar, Odisha. He is also co-director of IDS Cochrane Affiliate Center under Cochrane India Network. He has been associated with Cochrane as a member since 2014 and contributed many systematic reviews related to the oral health. A very warm welcome to Dr. Saurabh Panda, and he is going to speak about the training on Cochrane oral health review, planning, undertaking, and the reporting.
Thank you, Dr. Good afternoon, all. I hope the tea break has made us mind free. After such enriched sessions by all eminent speakers, thank you for giving me such an opportunity to speak on such an esteemed platform. So I will be taking on the training part of the Cochrane reviews, where we can plan, understand, and how to report a Cochrane review. Dr. Kusum, can I share my screen?
Yes, sir.
Is the screen visible?
Yes, sir.
So training in itself is a very vast workshop, which usually takes around 2 to 3 days for better understanding. And anyways, with such a little limited time, I hope to give you a snapshot on how to conduct a Cochrane review or write a Cochrane protocol. So to start with, this is my disclosure that most of the part of my presentation may be in accordance with the Cochrane Handbook Systematic Review by Higgins. Coming to the oral health issue, as Cochrane has many Cochrane review groups. So one of the group which is dealing with Cochrane oral health is the Cochrane Oral Health Group, which is managed by Division of Dentistry, University of Manchester, UK. There are more than 1,600 members and over 900 review authors contributing from different countries, 40 different countries. And these systematic reviews only publishes systematic reviews of best quality research available to the people to make informed decisions about oral healthcare choices. So these reviews gets published in a journal called as Cochrane Database of Systematic Review. Now, Cochrane accepting all the systematic reviews which is related to intervention, reviews of diagnostic test accuracies, prognosis reviews, methodological reviews, and overviews of reviews, and also some qualitative reviews and rapid reviews. Now, first, if we plan for a systematic review, Cochrane systematic review, the first step is to register. So first thing, to work with a Cochrane oral health group, so we have to first work with this review group. So what they will provide us is they will provide us with ongoing editorial and other supports throughout our preparation of the review from proposal to submission. Now, they also offer some specific services like translation, statistical advice, and in case some expert information specialist to assist in developing such strategies. And also they help us in conducting research searches in electronic databases. Now, once your protocol and review is completed, this Cochrane Oral Health Group will coordinate with the editorial and the peer review to determine whether this manuscript should be published or should be referred to any other non-Cochrane journal. Now, first step in proposing a new Cochrane review is prospective registration of the review proposal. Now, this registration should take place before your review work starts. Now, you have to come in contact with Cochrane Oral Health Group editorial team. There is, as Balendra Pratap sir already mentioned, there is a title registration form. So you have to first register the title. Then this Cochrane Oral Health Group will conduct some priority setting activities, as already told by Ashima madam about the works, how the Cochrane Oral Health Group work in setting the priority process. So they will identify these topic areas and these specific review questions they will consider to be high quality. If they consider this to be a high quality, then only they will ask the review authors to develop the protocol. If not, the authors will be advised to proceed with the review outside the Cochrane and publish it in another journal. Now, how to structure this review title? We already know that we have to follow the PICO format, and the title should always be brief about the intervention to be reviewed and the problem at which the intervention is directed. In some cases, you also may state the specific population or the setting. So what is this PICO strategy? We already have discussed about it. P is the patient or the population or the problem. I stands for the intervention which we are looking for. And C is the comparison with which the intervention should be compared with. And outcome, what are the measures we will be assessing? So all these, the Cochrane. So I will give you a few examples on the different review titles which can be framed. The first basic structure is the intervention from health problem, where we can have this kind of a topic, antimicrobials for gingivitis. Or we can have a questions on comparing of two active ingredients, like an intervention A versus an intervention B for a health problem, like surgical versus non-surgical periodontal therapy for periodontitis. Or you can have an intervention for health problem in different participation group or a location, where an example would be, better example would be fluorides for dental caries in children. Or title can be an intervention in a specific group, like the smartphone-based dental education for elderly, or can be a prevention intervention for preventing or treating a health problem, like example would be oil pulling for preventing gingivitis or growth factors for treating bony defects. Now, how to prepare a protocol? The preparation of the protocol starts with, so you have to first prepare a priorly the Cochrane protocol, and this protocol has a chance to get published in Cochrane database of systematic reviews, which is indexed in Cochrane library. And also, these Cochrane protocols are automatically registered in Prospero databases, as it allows transparency and accountability. As within any study, if the methods proposed in the protocol are changed during the course of conducting the review, this should be mentioned in the full review under the heading differences between the protocol and the review section of the completed review. So this is the snapshot of the protocol outline, what all we should mention while giving the protocol outline. So we should mention about the background, which is the rationale of the study, or we should tell how the intervention might work, what is the description of the condition, what is the description of the intervention, how important is why we do this review. We also should state the aims and the objectives of the review, and tell the complete method, how you will be extracting the studies, how will be selecting the studies, how will be searching the literature, where and when you will be searching the literature, what is the time frame, and what is the databases you will be using for literature search. And also you have to inform them about the data collection process, how you will be collecting the data, and how you will be analyzing the data, also has to be there in the protocol outline. Also, there are some information you have to tell who will be the prospective authors of this review, what each review author will be doing, what is their contribution, what is the sources of support, whether have you got any source of support from your institution or from any organization for conducting the systematic review, what are your conflict of interest, declaration of interest, are you related to or directly with the intervention, are you in a company which is sponsoring that intervention. So all this information has to be there in a protocol. Now next, setting up a review author team. Now the Cochrane review is not should be done by one person, it's a teamwork. So it should be undertaken by more than one person. So in putting together a team, an author should consider that experts should be there in the team. So a clinical and methodological expertise for the review is required. So when a proposal of the new review is received by the Cochrane Oral Health Group, this Cochrane Oral Health editorial team will consider not only the clarity of the review question, but also the skills and experience of the The first-time reviewers should be encouraged to work with the others who are already experienced in the process of conducting systematic reviews or Cochrane systematic reviews, and make use of the training and the guiding resources available in the Cochrane site. Now, what is the criteria of National Committee of Medical Journal Editors criteria for authors? When deciding who appears in the byline of the Cochrane review, only those individuals who have done the substantial contribution to the review can be listed. And these contributions, I already, as I have mentioned, it should be mentioned in the contributions of the author, put in the acknowledgement section with written permission. Now, how much time does this Cochrane review takes? The Cochrane reviews, after your title is registered by the editorial board, they give you a 6 months time to submit the protocol. If there is no protocol received from your end, this registered title becomes available to other interested reviewers who can apply for the protocol submission. Now, once this protocol is submitted by you, they again give you 1.5 years to go for the full review. If no review could be delivered within that span of time, this registered title again becomes available to others. So every 2 years, as this is a long time frame, new evidences comes in. So these new evidences needs to be incorporated. And I should tell you, these Cochrane reviews are so meticulous. They give you timely emails. They give you timely correspondence from all information specialists. They will be in contact with you. They will be telling there is a new search which has come up, and you can select the studies from those searches. So they help you in every aspect while conducting the review and also while updating the review every 2 years. Now, what are the resources provided by this Cochrane Oral Health Group? They give searching assistance. Either by the editorial team of the Cochrane Oral Health Group or by a local information specialist. They give regular updates on the search, informing authors for inclusion of the new evidences. They give timely reminders on on-time completion of work. They also give support of the softwares, where I think Dr. Raghu will be dealing about the softwares in my next presentation, about RefMan 5.4, Covidence, AP Reviewer, Grade Pro, GDT. All these are softwares which you will be using for conducting this review. And also they have prepared few handbooks for easy understanding of Cochrane protocols. Like Higgins book is available in the site, free to download. So you can download and check, and all these informations are available in Higgins book. And also, while using this RefMan software, there is a additional column called as methodological expectations for Cochrane interventional reviews, called as MECIR, where they have pulled out all the chapters of the Higgins methodological book, and they have tagged it along with the different subsections. So it will be easy while entering the reviews in the RefMan directly. You can look up for any kind of comments or any kind of information from the Cochrane handbook simultaneously. Now, also the training Cochrane Oral Growth Group provides learning modules where you can go to visit this site, where you can find there are different interactive modules where the training can be conducted. Now, what are the additional resources required by us apart from what is provided by the Cochrane Oral Growth Group? We require some additional library resources. As we know, PubMed is free, but we also require some electronic databases like Embase, which are not free of cost. It has to be supported by the organization. And also there are some interlibrary loans, like if there is some articles which are not available, you can request another library for such articles to be sponsored. Also, we will require some statistical support in case nowadays network meta-analysis are the choices, because these gives you a broad spectrum of analysis. Now, these statistical support can also be taken up by the authors. Also, you need computers, softwares, which is provided by the Cochrane. You need supplies, services, internet connections, printing, telephone charges. So office spaces for staff, and also some travel funds for author meetings. Now, coming to the reporting of Cochrane Oral Health Review. Now, the reporting of a protocol should always be written in a future tense. The protocol is a public record of question of interest and intended methods before the results are fully known. Now, this protocol helps the reader to judge how the eligibility criteria of the review, stated outcomes, and planned methods will be addressed the intended questions of interest. And it also helps anyone who evaluates the completed review to judge how far it has fulfilled its original objectives. Now, as I already mentioned, it should be in future tense because Cochrane reviews are updated as new evidences accumulates, and methods outlined in the protocol should generally be written as if suitably large number of studies will be identified to allow the objectives to be met. Now, what should a protocol? Already this has been covered, but I will go one by one detailed. Background should be covering all these descriptions of the intervention, how the intervention might work, what is the rationale behind giving this intervention, how important is this to do this review. The objectives, you have to tell what are the objectives, why are we doing the systematic reviews, what are the outcomes which you will be assessing, and all the details regarding the measures has to be detailed. And also the criteria for considering the studies, the eligibility criteria, the inclusion criteria, the exclusion criteria, what all studies will be included in our systematic review, all this has to be pulled out. Now the search methods, all the complete search strategy, you have to pre-run a search strategy. You have to tell them this strategy has to be run on different databases. You have to give all the protocol search methods to the Cochrane that we will be searching this and these databases under these and these keywords. All this has to be priorly given. Also, the data collection and analysis, the types of information, all the reports of the included studies, methods for obtaining such information, how the risk of bias will be considered for the included studies, and also the intended statistical methods for combining the results also has to be made. Whether I will be conducting a meta-analysis or not, in what circumstances a meta-analysis will be conducted, if not, what will be my alternative method of analysis of my data, all this, or whether I will be going for heterogeneity analysis, whether I will be going for a sensitivity analysis, all this will be taken further in by I think Dr. Arpit Gupta. And other information like also the acknowledgements, contribution of authors, declaration of interest, and source of support also to be mentioned in the protocol. Now, coming to a full Cochrane review, the main text of the full Cochrane review should be crisp and readable, and there is no formal word limit for it. You should consider 10,000 words to be a maximum or the main text for the reviews, and most importantly, it should be easy to read and understand. Because the review, because as told, this is targeting the audience of healthcare professionals, consumers, policymakers, all non-expert fields. So you have to be easy to read and understand. So author also should ensure that reporting of objectives, important outcomes, results, caveats or limitations, and conclusion is consistent throughout the main text, and the tables and figures, the abstract and other summary versions of the reviews should be clearly mentioned. And yes, importantly, plagiarism is not accepted and all information should be cited. Coming to the abstract, all reviews should have an abstract not more than 1,000 words. So target primarily healthcare decision makers, so rather not to the researchers. So it should be simple, easy to understand language. There should be no abbreviations present throughout the abstract, unless and until it is well accepted abbreviations. And abstracts of these Cochrane reviews are freely made available on the internet and published in the bibliographic databases of Cochrane database systematic reviews, which is indexed both in Medline and MBIS. Now, as in protocol, the full reviews also has the similar line, but in a detailed version. So you have to go in detail about each and topic what you have already touched in the protocol. We have to detail it as how and when you did it. So you have here everything will be in the past tense. So all the methods will be we did it. Like protocol, we will be doing it. So all this has to be mentioned. So here the different part is the main results. What results you have got after doing this. So all these findings of all important benefits, harm outcomes, and the statistical significance, the magnitude and direction of the result, along with the assessment of the certainty of evidence, which summarizes the impact of the risk and inconsistency among the studies, imprecision. All this has to be given in the main results of the full Cochrane reviews. Now, all these full Cochrane reviews has a plain language summary. Now, this plain language summary, the stand-alone summary of the systematic. Like the abstract, the plain language summary is maybe read alone, and overall messages should be consistent with the conclusions in the full review. Now, this is targeting the audience who are non-expert readers. So you should not use any technical terms. Even if you use a technical term, you have to rather explain it what kind of a technical term it is, because it will be used by the general public for their information. So the audience of this plain language summaries include the people with health conditions, the caregivers, the health care workers, and policymakers. So also there is a like option of translating this plain language summary into the local language, because the readers may not have English as their first language. So the Cochrane has taken up this huge task to also translate this plain language summaries and make these things available for the readers. Okay, so now, as I have already told, the background and the objectives should contain all these important descriptions of conditions, intervention, how the intervention might work, and why is it important to do this review. So now, immediately following the background section of this review authors should declare the review objectives. This should begin with a precise statement of the primary objective of the review, ideally in a single sentence. Where possible, the style should be in the form to assess the effects of which intervention versus which comparison for the health problem for in the types of people, the disease of or the problem or the setting it's specified. It should specifically follow the PICO strategy. Coming to the method section in a completed review should be written in the past tense and should describe what was done to obtain the results and the conclusion of this review. The protocol number should be cited with the registration number or the DOI number as published in the Cochrane database of systematic review. Any deviation or difference from the protocol should be detailed under differences from the protocol and the full review section. Also, the criteria for considering the reviews study, the eligibility criteria like the inclusion and the exclusion criteria should be mentioned. Also, the search methods should be detailed in this section, where and what, whether you have searched the central, whether you have searched the PubMed, whether you have searched Scopus, or any different databases all should be mentioned. Also, you should tell what was the time frame which was given to search, and when was the last search done, whether you have taken up any bibliometric screening, or whether you have hand searched any relevant journals, or you have searched the grey literature. If you have searched the grey literature, till when and where, which site have you used to search the grey? So all this comprehensive search should be mentioned in the methods section. And also you have to mention how did you select the studies, whether you have used any software like citation manager in order to compile all these citations which you have searched from different search databases, whether you have used some kind of a software called as Covidence or some kind of a software called as Epi Reviewer in order to select the studies. And how have you done, on what grounds have you done the data collections and management, like what all parameters you have assessed in the data collection. So also the assessment of risk of bias, as this is all this Cochrane reviews are interventional reviews, they have their own Cochrane risk of bias assessment tools, where they have 6 domains to assess the risk of bias based on different bias sections. So these all has to be mentioned Also, the measures of treatment effect, how did you measure whether it was a continuous variable, whether it was a dichotomous variable? If it is a continuous variable, how did you represent that measure of treatment effect, whether it was represented as mean and standard deviation, whether it was represented as odds ratio or a relative risk? All this unit of analysis also has to be taken care. Also, if there is a data missing data, how did you deal with the missing data? Whether you approached any authors to find out whether the raw data is provided or not, whether they have in accordance with the protocol they have submitted for the trial or not. So all this dealing with the missing data information has to be already there. And also you have to assess the heterogeneity along the studies, included studies, like whether how heterogeneous they are in terms of geographic distribution, in terms of eligibility criteria, in terms of recruitment status, in terms of demographic criteria. All this has to be mentioned. Now, again, we have to also detail about data synthesis, like whether you have gone for only qualitative analysis or whether you have gone for the quantitative analysis, like whether you have gone for meta-analysis or network meta-analysis, or you have conducted any subgroup analysis. All this has to be mentioned. Coming to the results, this should be divided into different subsections, where you have to first give the description of included studies, where you have to briefly tell about what study design you have, all the included studies are of, and the demographic characteristics of each recruitment patients, like age, gender, etc., sample size of each study, details of all interventions, outcome measured, what is the funding source, and what is the declaration of interest among the primary researchers of that primary study has to be mentioned for all the included studies. After that, you have to present the results of the risk of bias assessment, what you did under the method section, and also the any effect of intervention, like the measures, what you have, the treatment effect, what you have got, whether it is favoring the intervention A, whether it is favoring the intervention B, or it is neutral. All these effects of intervention has to be mentioned on the results section. And also the results of the studies should be synthesized in form of tables and figures. Now, coming to the discussion, you should first explain the summary of the main result. You have to give now the concise description of the results for the main outcomes of the reviews. And this section should only focus on those who are most prominent in this review. And also you have to comment on the overall completeness and applicability, where an assessment of how well the evidence identified in the review addressed by the review question, and whether the studies identified were sufficient enough to address all the objectives of the review. Alternately, grade has to be applied in all the Cochrane reviews, where you have, this is a software which is available, Grade Pro, which I think Dr. Raghu will be dealing next. So all the certainty of the evidence has to be taken care, and how certain is the evidence, whether you will upgrade the evidence to a higher level or downgrade the evidence to a lower level. All this can be done using this Grade Pro. And also all the potential biases and all the limitations which has been faced by while conducting these reviews has also to be considered in this section. And also you have to mention the agreements, disagreements with other studies and reviews, differences in eligibility criteria, search methods used by other reviews, how the search methods are very explicit in a Cochrane review, your review. So all this has to be discussed under the discussion section. So coming to the final part of the Cochrane review, that is the conclusion. There are two standard sections where you have to tell about the implication for the practice, and again you have to tell about the implications of research. In the implication of practice, you should provide a general interpretation of the evidence so that it can be inform healthcare and policy decision makers. And relative value of likely benefits and harms of the intervention should be mentioned. And recommendations on how the intervention should be implemented and used in the practice should not be given in the Cochrane review. You cannot give a recommendation. You can only say whether it is having a likely benefit or likely harm to the intervention. And next, implications of research. It has to be used by the people making decisions about future research. So you can say that how best evidence has been collected, how whether this evidence is apt for answering this research question or not? If not apt, how better a research can be conducted in future so that this question can be answered. So apart from that, you can give the administrative information, that is the contribution of authors, declaration of interest, acknowledgements, and differences between the protocol and review and source of support. So this is the format how a Cochrane will expect its protocol and the review should be submitted. And these all has been incorporated into a tool called as RevMan 5.4 version tool, where you can find all these subheadings with an empty space and all the guidelines which is attached, linked to those subheadings, you can find out. So this is a review ecosystem which has been delivered by Cochrane, where they are giving review databases, PicoLink data, RK databases, and CRS databases, where with all kind of apps, softwares, called as RevMan Web, link data tools, evidence pipelines, Covidence, EpiReviewer, Magic App, Grade Pro, all these kind of applications are provided by the Cochrane, where the authors can use it and conduct the systematic reviews. Also, for finding out the evidence, they have certain review groups, training which will be conducted, Cochrane Crowd, Task Exchange, editing support is provided by the Cochrane. And yes, this is the whole process of making a systematic review, how we develop a question, how we plan the methods, write and publish a protocol, then develop a protocol, then we go for the assessing of risk of bias of all the data, then analyze the data, interpret the findings, and finally write and publish a full review. So thank you for your kind attention. If any queries, please contact me over my personal email or our official email at idscochrane@soa.ac.in. Thank you, ma'am. Thank you for a great opportunity to speak on this esteemed platform.
Thank you very much, Dr. Saurabh, for such a wonderful talk on protocol writing. We will have a workshop on protocol writing in the next month, which we usually do. Now we've started doing these workshops almost every month. And I just have a few suggestions to all the participants who would like to do a Cochrane review and write a protocol. Is that first, please have a question. I mean, these are just tips, like off the mark tips for doing. Have your question ready and you write that PICO in a very proper format, depending upon whether this is intervention or a diagnostic review, because so far Cochrane is taking only this type of reviews. Then what you should do is read a Cochrane review, a detailed Cochrane review on a similar topic, so that you get to know what are the different headings under which a review is published, because as Saurabh had said, the first few of them will constitute the protocol, which is written in the future tense, where a review is of course written in the past tense because you've already done it. So as you know, in any other protocol, we write a justification, which is in the form of a background as to what is the information which is already known, what is not known, what is the importance of the condition, whether it is intervention which would be taken up, cost effective or not. So all these things will come in the background. And then you will have to have all the components of, search strategy, inclusion, exclusion criteria, risk of bias tools, statistical tools, whether or not you will be doing sensitivity analysis. So all those things will be written in the protocol. The next thing is, along with writing the protocol, before actually you launch on writing, also get in touch with the relevant Cochrane review group. And in your case, this will be the oral health sciences group. And there you send your title and see if that title gets registered with the Cochrane, because they have editorial meetings in which they decide about whether this topic needs to be done or it is part of a particular review or it is not of a high priority. So those things, and after you have that title registered, then of course you should quickly write your review and send it, submit it to the editorial base, and they will then have a look at it and give you a lot of suggestions and then get it published. And once a protocol is published, then you also start doing your review. But there is no harm in continuing to do your review, because if Cochrane doesn't publish it, you can also publish it as a non-Cochrane review, because Cochrane does allow you to use their software like RevMan for non-Cochrane reviews as well. So I think first thing first, all of you, all the 95 participants, I think I had a problem re-entering into the system, because I think we've had a low dropout rate, and that's good. So all of you have a question, convert it into a PICO, do some preliminary search or scoping, and then go for a title registration and also read a relevant review. Thank you. Thank you very much. Any other questions or comments? We have, okay, it's only about, is checking and reporting in I-square value essential in all systematic review? Would you like to take this up, Saurabh?
Yes, actually, it is a measure of heterogeneity. So in the I-square statistics has to be done to check whether the studies are homogeneous or the studies are heterogeneous. So as mentioned by the Cochrane, if the heterogeneity value, what I-square is more than 70%. So we consider it, the data to be more heterogeneous. So we cannot give a conclusion, a definite conclusion on the topic. And we should always ask for more evidence to make more homogeneous studies to be there in the literature. So if we were less than 40%, then we definitely consider to be a homogeneous aspect. The homogeneity is better, and we can give a definite conclusion on the same.
Thank you. So chi-square or I-square values are essential for every review after you've done it. So in a protocol, you will just write that you will use these statistics to determine the statistical heterogeneity. There is another heterogeneity, which is methodological heterogeneity, which has more descriptive, and that might even determine your sensitivity analysis or whether you really want to include some of those studies. So I think with this, we will end this session, because we are about half an hour late with our program. But I think in between, some discussion is always good, because otherwise the program gets very, very monolithic. So Dr. Kusum, would you like to now take us forward?
Yes, ma'am. Thank you, sir. Definitely your presentation has enhanced the knowledge of dental practitioners who all are attending the workshop today. Our next speaker is Professor Raghuvar Dayal Singh. He is a professor in the Department of Prosthodontics, King George Medical University, Lucknow. He is also co-director of Cochrane India KGFU Affiliate Center. He has filed 3 patents and 3 copyrights and published a number of papers in the international and the national journals of repute. He has been in the editorial board and the review panel members of about 11 academic bodies. Thank you, sir. We would like to welcome you on the behalf of PGIMER Chandigarh. Over to you, sir.
Thank you, ma'am. First, good afternoon to everyone. First, I would like to thank Professor Minu Singh, ma'am, for giving me a chance to speak in such a good webinar, and also congratulations for organizing first of this kind of webinar on Cochrane. So I was given a topic on introduction to Cochrane tools, resources, handbooks, RevMan, Covidence, and grade. Systemic review should be replicable and retaining a record of the inclusion decision, data collection, transformation, or adjustment of data. For that, Cochrane has provided various tools for that. Like there are various Cochrane centers for training to write a good review. There are handbooks are available, softwares, various softwares are there, and Cochrane library is there, which helps to write a good systemic review. So first, I would like to discuss about the Cochrane handbooks for systemic reviews of interventions. It is official guide that describes in detail the process of preparing and maintaining Cochrane systemic review on the effect of healthcare interventions. Handbook includes guidelines. It provides guidance on various topics like planning a review, how to plan a review, searching and selecting studies, data collection, risk of bias assessment, statistical analysis, grade, and interpreting results. This is a website. On the Cochrane website, we can get the Cochrane handbook for systemic review of interventions. And this is 6.3 is the latest version of this, and everything is given here, starting from the introduction to the core methods to how to write a good systemic review and how to make it available. So everything is given on the website. So these are the, we can see both the, we can refer both the soft copy as well as the hard copy. To cite the full handbook online, we can, this is a website given here. We can go on the website and we can download the handbook. And even there is a print version also is available of a handbook. And for that, we have to contact the, we have on the website, we have to contact the editor for that. And we can get the hard copy. But before, we have to take the permission to reuse the material. If you want to reuse use the material of the handbook, so with that, for that, we have to take the permission. If it is academic and non-commercial purpose, so it is free of cost. Just we have to fill a short web form, and once we will get the approval, then we can use the matter. But if we want to use for the commercial purpose, then for that also we have to take the permission, and there is some monetary fees for that, and we have to pay for that. On the website, there are various versions are available of the handbook, and we can see and we can download according to that. So another tool for systemic review is Covidence. This Covidence software. It is recognized by Cochrane as the primary screening and data extraction for Cochrane authors conducting standard intervention reviews. It is designed to make review production more efficient. It is free of cost for Cochrane review, but for non-Cochrane review, we have to pay for this. Covidence is designed to perform the following functions, like it can upload search results, screen abstracts and full text study reports. It can complete the data collection. It can conduct a risk of bias assessment, resolve disagreements. And after that, all these things, we can transfer the data to the another software. So for our study, we have to start from the Covidence software. This is a website of the Covidence. Here, we can go on the website and we can sign it. Here we can see it here. If anyone is a Cochrane reviewer, so directly he can sign with the Cochrane. There it is free of cost. But if non-Cochrane review, we have to take a subscription of this software. These are the different price, and different packages are there. For single package, it is around 18,000 Indian rupees. And if you want to take a 3 package, it is a package in a 3 review, so it is around 48 to 49,000. So for that, we have to pay it. For it is a 1-year subscription. But for Cochrane review, if it is Cochrane review, then it is freely available on the Cochrane website. Okay. So once we will download this Covidence software and we will log in it, then it comes that start a new review. We'll click it here, and we have to add our title of the review. After writing after title, we have to import the references. First, we have to, once we have selected the title for our systemic review or for our Cochrane review, so we have to form a PICO, and according to that, we have to search the articles on the various platforms. After that, we have to save that references on our desktop, or directly we can transfer it from the that software to this Covidence. We can here it is import button is there. After importing, we can import how much articles what is there. All the references we can import in the Covidence software. Covidence software, it has a feature that it will remove the duplicate articles. even it has a settings. We can setting once we have included the references. Once we have imported all the references in the Covidence software, then we have to select the reviewers who will review the articles. So mostly minimum we have to take 2 reviewers, but that depends. Even we can include 3 or 4. That depends on the owner of the reviewer. Like in these articles, there were total 1729 articles were imported. Out of that, 15 were were removed because they were duplicates. Then remaining in 1714, the screening was done by the reviewers. And after the screening, it was found around 1597 it was found that they were irrelevant to the study and they were removed. And finally, there were 1714 articles. These are the articles which are related to the study. So for this article, 1714 articles, we have to do the full text review because they were the abstract screening. Now we have to do a full text review. For full text review, also we require more than 2 reviewers. And if there is any conflict or any conflict of interest is there or any dispute is there, so we have to dissolve the dispute. After screening the full text, here like 117 were there full text, so we've found that only 20 or 21 articles are related to our studies. So for that studies, now we have to do a data extraction. In data extraction, there is a template. Data extraction template is available on the Covidence software, but we have to make our own template for our individual study. According to our study, we have to form it, we have to make it. And we have to fill up all the informations like a title of the study, author, who was the author of the article, then where studies were done, and methodology. What was the aim of the study design, everything of that particular article. We have to extract that particular article. Data extraction we have to done, and we have to fill all the datas in this template like this. From like this article is from summary, what was where this study was done, who was the author, what was the design of the study, then from the method, population, interventions, and outcome. Everything we have to fill up in the template. So after filling all the, after extracting all the data, after extracting data of all the selected articles, we have to compile it, because this is an individual data, individual extraction. So now we have to compile all this data. So for that, we have to transfer these data to another software, that is RevMan. We require RevMan or Review Manager. So for transferring the data from Covidence to Review Manager, we have to form in Review. First, we have to open the website. It is freely available software on the website ReviewMan. We have to log in. We have to create we have to log in it. We have to create our account and we have to log in it, and then we have to form a file, empty file on the RevMan, and that empty file we have to import. We have to export in Covidence. Then once we will export it into the Covidence, then automatically the data which are there extracted in the Covidence, they will populate it in that empty files, and after that again we can import that file into the RevMan, and in the RevMan we can do the further things. We have to compile the data and we have to do the further compilation. So RevMan is a Cochrane software for preparing and maintaining Cochrane reviews. It facilitates preparing of protocol and full reviews, including text, characteristics of studies, comparison tables, and study data. It can perform meta-analysis of the data entered and present results graphically. So here, Cochrane provide a free software, RevMan software. It is even non-Cochrane review also, there is RevMan is available, but the difference is that in Cochrane provide RevMan web, and if you want to do a non-Cochrane review, then for that we have to download this software that is a Reumann 5. What is the difference? Reumann web, the significance of Reumann web is that even more than 2 reviewers can review the articles at the same time. But in Reumann 5 articles, it is not possible. Once only one person can review the article. Here also same thing. We have to create our account. We have to log in it, and then we have to create a file. We have to export the data. We have to import the data from the Covidence. Here the other guidelines are given on the website, that how to use this software and how to import the data from the Covidence. Everything is given on the website. So Covidence will export the following information to review manager. That is list of included studies, list of excluded studies also, including the region of exclusion, characteristics of studies, which includes risk of bias table, study identification, study design, inclusion and exclusion criteria, baseline characteristics, intervention characteristics, outcome names, outcome comparisons, and any data that were collected during the extraction process. So all the data we have to import from the Covidence. After importing the data from the Covidence, we have to fill up the form. Here also there is a form template is available. We have to fill up everything, like what title of the title of the study, review information, main text, table, everything. It's like the articles we sent for publication. It's same like that. We have to write the author's name, all the author's name. We have to write the background, objectives, search methods, everything about our studies. Once it has been entered, all the data, then here we can see that all the data are now in a graph form. There are different studies are here, and the Reumann will compile all the data in a graph form, risk of bias graph. So as I told you that in Reumann we have to enter the data entry of authors, and then date when studies was conducted, when it was published, then title, abstract, discussion, studies, and everything about the data. And after this data will be compiled by the Reumann, risk of bias summaries of included studies will be formed, and according to that, the risk of bias graphs will be formed on the Reumann software. This is a funnel plot of publication bias. This plot will be formed when there is a studies more than 10. If there are more than 10 studies are included in the review, then we have to form a public funnel plot will be formed. Here this is a forest plot. Here we can see that this is a forest plot showing comparison of mandibular advancement device with placebo on apnea-hypnea index. Here we can see the dark diamond not crossing the midline, and it favors the mandibular advancement device. So it is formed in the Reumann software. So after compiling all the data, now we require that we want to check the quality of evidence and making recommendation. For that, we require another software, that is a grade. It is a grading of recommendations, assessment, development, and evaluations, which is the transparent framework for developing and presenting summaries of evidence, and provides a systemic approach for clinical practice recommendations. Grade, it is a most widely adopted tool for grading the quality of evidence and for making recommendations. In grade, recommendations can be strong or weak, in favor or against an intervention. So if there is a strong recommendation, so it suggests that all or almost all persons would choose that intervention. It is helpful for the population. If there is a weak recommendations, it will imply that there is likely to be an it is likely to be an important variation in the decision. So grade has 4 levels of evidence. It may be a very low, low, moderate, or high. So evidence from randomized control trials, RCT, starts at high quality, and that observational studies, they show a low quality. Grade domains are, there are 5 domains. We describe the rating of the grade, that may be a risk of bias, imprecision, inconsistency, indirectness, publication bias. So certainty in the evidence is increased or decreased for several reasons. These are described here in more details. It may be very low, low, as I told, moderate, it may be a high. Here, this table is showed the grade approach. Here we can see this is a study of mandibular advancement devices compared to sham or no treatment for individual with obstructive sleep apnea. Here we can see you can see the certainty of evidence. Here grade, we can see that AHI index, apnea hypopnea index. Here it is number of participants were 470, 9 RCTs were there, but then also the certainty of evidence is low. It may be due to the risk of biasness. Here it is moderate, low. So these things are done with the help of grade software. So now I would like to summarize these things. So if we want to do any review, any systemic review, so first we have to develop a protocol. We have to develop a plan that how to proceed with the review. Then we have to search the studies. After searching the studies, all the references, we have to transfer it into the Covidence software. Covidence software will extract data from the studies. It will then, after extracting the data of all the references, we have to transfer it in the Raymond software. Raymond software will combine the data, and it will show it will represent it in a graphical manner. Then to see the whether quality of the evidence, we have to use grade software, and after that, after grade, we have to and from this software only, even in this Raymond software also, we can include or exclude the data. Whatever data we have imported from the Covidence, we after some stage of the study, if we find that any data is not helpful or not related to the article, we can exclude it. Or even if we want to include any article, we can include also in this stage of the review process. And even from this stage also, we can submit the we can submit the review for publication also. So these are the link to download this software, Raymond, Covidence, and Grade, or else these are available on the Cochrane website, as I told earlier. So as I told that all this software except Covidence, if it is a Cochrane review, then it is freely available. And if it is non-Cochrane, then we have to pay for Covidence. Otherwise, all the other softwares, Raymond, Grade, and other softwares, they are freely available on the website. Thank you for your kind attention.
Thank you. Thank you, Dr. Raghavendra, for your
Thank you. Thank you, ma'am. Thank you.
very
so much.
nice presentation and taking us through all the steps of a systematic review. If there are any questions or comments, they are welcome. There was a question about imprecision. Somebody wanted to know about imprecision and how do we report it. Would you like to take up this question? This is more statistical actually, but it can be applied to a systematic review, especially when you are having wide confidence intervals or when we have a population which is not normally distributed. Would you like to take up this question, Dr. Raghavendra?
Okay, ma'am, I would like to take it. So
Yes, yes.
Yeah, imprecision is actually related to if the sample size is not sufficient enough in different RCTs. Then the imprecisions, the level of certainty of evidence by imprecision is going down, like maybe low or moderate or something like that. It may not be good. It also depends upon like the number of events. If the number of event is very less and confidence interval will actually overlap. In these cases, the imprecision leads to decrease in quality of certainty of evidence.
Yes, this is something like, when we are firing at a target, and if you are firing at a target, this is something about accuracy and precision, that if you're firing at a target and all the shots which you make, if they are falling on the target, then it is precise as well as accurate. But if they are getting fired all over, but at one place, distant from the actual target, then it is precise but not accurate. So this is something like we use as an analogy for differentiating between accuracy and precision. So as you said, if the sample size is small, there is a likelihood of having imprecision, because the confidence intervals which you will get around the mean will be quite wide. So these are some of the concepts which you have to learn in a basic statistical class. But you need to know all these once you have to interpret findings of a systematic review. So thank you very much, Dr. Raghuvi, for a very nice talk.
Thank you,
Dr. Kusum, what do we do next? I think we are now approaching the last two talks, and I know all of you must be hungry for lunch. So we will, you can all put your videos off. In any case, the participants are having their videos off so they can eat. But people who are going to speak, I think they will have to bear with us. So Dr. Kusum, would you like to introduce Dr. Arpit?
Yes, ma'am. Our next speaker is Dr. Arpit Gupta. He is an associate professor in preventive and community dentistry at Oral Health Sciences Center, PGIMER, Chandigarh. He has served All India AIMS, New Delhi as a senior resident and research officer under the National Oral Health Program. He has been keen interest in evidence synthesis, including health technology assessment, and has made significant contributions towards such initiatives. He is going to speak about the understanding forest floats and meta-analysis. I think many of the participants has raised many questions regarding eye care and imprecision. Now all of your queries are going to be clear by Dr. Arpit Gupta. Welcome, sir. Over to you.
Okay, so thank you, Dr. Kusum, and thank you, Madam Minu, and all the speakers for making my task relatively easy and setting the stage right for this particular presentation, where I will be talking more about forest plots, meta-analysis, and other related things. And so the term forest plot to begin.
Yeah, and you can explain accuracy and precision also when you are on the forest plots, I think. Yeah.
I'll take through those terms as well. Okay, so forest plot, as the name suggests, it was little new for me when I entered this world of evidence synthesis. So forest, it is entirely a different story. But slowly and gradually, when we really entered and we started doing meta-analysis and we started reporting it, and then we came to know that this is the core, this is the crux. And it is also evident with the fact that if you can see the Cochrane logo, within the logo, Cochrane has included a forest plot. So they are laying a lot of stress on forest plot. So through the next 20 minutes, I would be broadly talking about hierarchy of evidence, which Professor Ashima has already talked about. I will be telling you a bit about meta-analysis, the potential advantages of meta-analysis, interpreting the results of meta-analysis. Then I'll be also talking a bit about heterogeneity, which many of you were interested in knowing about, and then we'll conclude. Okay, so I'll be. Am I audible? I'm not sure. I think. Can anybody just confirm if I'm audible?
Yes, sir, you are audible.
Okay, thank you. Okay, so as we all know, I mean, a lot has been talked about that. A lot of literature is being published, and ultimately it is for the decision makers to decide on what to do and what not to do. And the pyramid, the evidence-based pyramid, which Madam Ashima has also talked about, it is already saying that systematic reviews and meta-analysis are on the top. Now, systematic review, we have already discussed a lot about it, but meta-analysis. Now, what is this meta-analysis and how it is done? So meta-analysis is nothing but it is a quantitative analysis of data which we have generated through the systematic review process. So once the systematic review is done, then there is a quantitative synthesis of this data, and the outcome, this process of doing the quantitative synthesis is known as meta-analysis. So the results of individual studies are combined to produce an overall statistics, and this is called as meta-analysis. Now, why do we need to do this meta-analysis? This is a question. Why do we need to combine results of various studies? Now, let us understand what are the advantages of doing a meta-analysis. First and foremost is to improve precision. Now, there was a term which we were just discussing about imprecision. So before going to imprecision, let us understand what is precision. Precision means simply means, okay, let me put it the other way around. If supposedly there is a study which says that water causes cancer, let's say, and it is a study on just like 3 individuals or 5 individuals, or let's say 10 individuals. So do you think that the study is having sufficient power, or let's say, can you rely on the results of this study? Probably not, because the sample which they have used is precisely less. So there is something known as OES. OES stands for optimal effect size. So, we always tend to do sample size estimations. I hope we are all aware of sample size estimation, which we do prior to any RCT or any study. Even if it is not an RCT, we do a sample size estimation. So why do we do a sample size estimation? Because we want to see what is the optimum sample required to answer this research question. That is OES, optimal effects. To know this optimal effect size, we need this much of a sample. Similarly, when we do pooling of this data, to be precise, to know for sure that the answer which we are getting is good enough, we need to have some sufficient quantity or some sufficient number with us, which if not available, we call it as imprecise. We call our estimates as imprecise. So to improve the precisions, we try to pull in data which is available from various studies done across the globe. Various similar studies. I won't say if there is a lot of dissimilarity between the studies, though then we cannot really pull in the data. But if there is considerable amount of similarity, we can pull in the data and we can improve the precision to get an information which is more reliable. So I hope this answers to the question of imprecision and precision. Okay, so then we do a meta-analysis to answer a question which is not posed by individual studies, because primary studies often, involve a specific type of participant or a specific type of an intervention. But a selection of studies will be helpful in answering a broad outcome. So when I talk about this, I'll just talk to you for an example. Let's say whether CPP, we have recently done a meta-analysis, and Dr. Kusum and Madam Minu was also a part of it, that whether CPP ACP is good enough for prevention of dental caries. Let us take it this way. But there are many studies on CPP ACP, right? Agreed. But if I put the question other way around, whether the calcium phosphate derivatives are good enough in preventing dental caries. So when I say calcium phosphate derivatives, CPP ACP is just one kind of a calcium phosphate derivative. There is a long list of other derivatives as well. So if I need to answer whether calcium phosphate derivatives are able to prevent dental caries, then definitely we need to pull in data from various studies, whether it was done on CPP ACP or TCP or maybe anything else. And to answer such kind of a research question, we need to do a meta-analysis. And then last but not the least, we need meta-analysis to settle controversies. At times people say that treatment modality A is better. Some studies say that treatment modality B is better. Now, to settle down such kind of conflicts, we need to pull in data from all these studies and we need to come out with a conclusive evidence. Okay, now coming on to some basics of biostatistics. I hope you all remember that outcome data. In the previous lecture, some speakers have already talked about PICO. So that is population intervention, comparator, and outcome. And I would add time as well to it. But nonetheless, if we talk about outcome, so this outcome data for randomized controlled trials are generally reported either as continuous variable. So when I say continuous variable, it means, let's say, mean DMFT score. So this mean DMFT score is kind of a continuous variable where we have mean and SD, mean and the standard deviation. Then we have an outcome data which is kind of dichotomous. So when I say dichotomous, it means simply yes or no, dead or alive, carious or non-carious, something like that. So in such cases, when we talk about dichotomous, we talk about events. Events means out of total number of X number of teeth, these many events were there or these many teeth were carious. So we are talking about a proportion over here. And whenever we talk about proportion, we generally rely on odds ratio, relative risk, and so on. And when we talk about mean and the standard deviation, we talk about mean difference or standardized mean difference, something like that. Apart from it, whenever we go ahead with the meta-analysis, we also talk about the method which is being used. And going into the details of the method is little out of scope, and considering the time constraint, I'll just introduce you to these terms where we have two kinds of methods. One is fixed effect methods and another one is a random effect method. So just to understand, fixed effect method simply means that there is a good amount of uniformity amongst the studies. Therefore, we are assuming that the effect is fixed. Whereas whenever we feel that there is a certain amount of methodological heterogeneity which is already present among the included studies, in such cases, we tend to go ahead with random effect methods. When we talk about fixed effect methods, we have Mantel-Hassel, the Pareto, and the inverse variance methods. Traditionally, we have been seeing studies which are reporting very less number of events. So for most of the Cochrane reviews, if we are using a fixed effect method, we tend to use Mantel-Hassel. And if we are having a good number of events, we can use inverse variance as well. But for random effect methods, we are left with only one way of doing it, that is the inverse variance. Coming on to the interpretation of a meta-analysis. Now, let us have a broad look at these two figures which are being displayed. One is figure A and another one is figure B. Coming on to a basic understanding of a forest plot. Before going that, let us look at this slide, which says that forest plot, as the name refers to, these are like forest of lines, which are horizontal lines which are drawn, and there is a vertical line as well. The technical name of this forest plot traditionally has been a blobogram, and it is nothing but a graphical display of estimated results from a number of scientific studies addressing the same question along with the overall results. So I'll just introduce you to this figure. Let us have a broad look at this figure. So this is a classical representation of a forest plot. Now, if we look at this forest plot, it is largely divided into three zones. So this zone, I hope my cursor is visible, if somebody can just confirm.
It's visible. It's visible.
Yeah. So we have this zone. This is known as the data zone. So in this data zone, we have individual studies over here. This is the study identifier where we have the author's name and the year in which the study was published, along with the data which has been directly extracted from this particular study. And you can see various studies are arranged in individual rows. And this is either sorted in an alphabetical manner, or it is either sorted in a manner as per the year of publication. So either of these is fine. And some people do sort it as per the weight of the study. So I'll come on to the weight later on what weight is all about. Now, if I look at this data zone, we have the study identifier, we have this data which has been extracted from the study, and then we have this total. And here are the two groups, the caffeine and the decaffeine group. Then we have this estimate of odds ratio, and then we have the weight of the study. This is followed by this area, which is called as the graphical area, where we have this forest plot. And these particular horizontal lines, these lines represent these corresponding studies. So if I talk about this study on the topmost, so this line represents this study. Then we have this lower portion, which is known as the statistical zone, where we have the total events, we have the heterogeneity, which is in terms of I-square, we have the test for overall effect. So now taking at a closer look, the study identifier, and then every study identifier is being represented by a square. Now this square simply means the point estimate. This is the point estimate, and this point estimate is followed by these wings or wickers on both the sides, which are nothing but a representation of the 95% confidence interval. So when I say 95% confidence interval, just to make it very simple to understand, a study which is having a wider confidence interval is less precise than a study which is having narrower confidence interval. And when I say confidence interval, it simply means that if this particular study is being conducted 100 times, then 95% of those readings will lie between this lower and the upper limit. I hope I'm making clear on this. Okay, now this forest plot has two axes. One is the x-axis and the y-axis. So this x-axis here, it is representing odds ratio. So odds ratio from 0.01 to 100, and this y-axis is nothing but it is representing these studies which are arranged in an alphabetical manner over here. Now talking about the size of this square, you can see, some squares are small, some squares are big. So the size of the square is determined by the weight of the study. Now what is the weight of the study? Now the weight of the study is basically a graphical representation. It is a representation of the sample size and the statistical power. If I look over here, if you can have a closer look over here, this study by Knott's Cafe 1998 has got the highest weight. Highest weight is 21.6%. And you can see the sample size here is 68 and 64. So it has the highest sample size. So the more the sample size, the more is the weight. But sample size is not the only criteria for defining weight. There are other criteria as well. And different methods, like here inverse variance was used. MH method will use a different way of estimating the weight. Peto will use a different way of estimating the weight. So, the studies are not weighted equally. Studies which are giving better statistical power are given more weightage, and studies which are giving poor statistical power are given less weightage. So based on this, these studies are arranged. And if you can see, there is a vertical line which is crossing 1. This is known as line of no effect. So why we call it as line of no effect means, here we are representing the odds ratio. And whenever we talk about ratio, a ratio of 1 means that there is no difference. I hope I'm clear on this. So that is why this line of no effect is running through 1. So a simple understanding here is that any study, if the confidence interval of the study crosses this line of no effect, then it simply means that your results are not statistically significant. However, if the 95% confidence intervals, they do not cross this line, then it simply means that the results are significant, and the results may favor the left-hand side or it may favor the right-hand side. So just to keep it simple and to understand it, the study number 1 by Amore et al., we can see we have a point estimate where we have an odds ratio of 0.17, which is being represented over here. And it is having a confidence interval ranging from 0.03 to 0.83. And it is not crossing this vertical line of no effect. That simply means that the results given by this study are statistically significant. However, if you look at the second study, you can see the 95% confidence interval is crossing the line of no effect. That means if this study is repeated 100 times, then there could be some results which are in favor of decaf, and some results, sometimes it could give results which are in favor of caffeine. So that is why there is this is not a significant estimate. Coming on to this portion, and particularly the heterogeneity, where we are talking about I-square. Before I come to I-square, let us have a look on this diamond. This diamond at the bottom. This diamond is nothing but this is the overall estimate. This is the pooled estimate. So it simply means that when the data from all these studies were combined together, we were able to find these estimates. So there is a peak of this diamond. You can see this peak, and there are these extremities. So this peak represents the point estimate. So in this case, the point estimate is 1.41. But when we take a closer look at the 95% confidence interval, we can see that it ranges from 0.78 to 2.56, and it is crossing the line of no effect, which simply means that these estimates are not statistically significant. And this can be visually very easily seen through this forest plot. And this can also be verified by this test of overall effect, where we can find a p-value of 0.25, which is definitely more than 0.05, which simply means that this overall pooled estimates are not statistically significant. Now, there could be a possibility that we might have compared apples with oranges. There might be ample amount of discrepancies, or let's say heterogeneity, between these studies. So when we talk of heterogeneity, we talk about statistical heterogeneity and we talk about methodological heterogeneity. So methodological heterogeneity should be taken care of on the first instant before pooling the data itself. But there could be some statistical heterogeneity. And if that kind of an heterogeneity is there, to judge the heterogeneity, we have an estimate which is called as I-square. So we'll look up to this I-square. And traditionally, it has been suggested that 40 to 50% of I-square means mild to moderate I-square, which is kind of acceptable. But if it is more than 50, then they say that it is kind of severe heterogeneity. And in those cases, we have to look into some other things, which I'll be just touching upon in subsequent slides. So an important thing to understand is don't just go blindly for the forest plot. Always look into the I-square, which is being represented over there. If the I-square is considerably high, then we are not entitled to rely on the results of that pooling. Okay, so again, this is the same study. If you can see in this study, we have events and the total. So the data over here is dichotomous. That is why we are reporting odds ratio over here. However, if you take a closer look on this study, the data over here is in terms of a continuous data, in terms of mean and the standard deviation. And when we talk about mean and standard deviation, we try to go for mean difference or standardized mean difference. So I am not going into the detail, when to go for SMD or when to go for MD. A simple understanding over here is that we can see an I-square which is pretty high over here, which is 89%. So now the question arises, what to do if we are having an I-square which is very large, which is more than 50%. This is again one more example where we are talking about I-square, which is 92%. If you can see this forest plot, this is the line of no effect. There are certain studies on the left-hand side which are favoring vaccine, and a couple of them are on the right-hand side which are favoring control, but the results are not statistically significant. However, the high I-square is 92%, which is considerably high. So now what to do if I-square is too high? If the heterogeneity is too high, first and foremost, check again that the data which you have entered, the raw data which you have entered is correct or not. At times there could be a wrong entry of data, or there could be some problem with the data extraction, which might be a cause of this high heterogeneity. Another way of understanding is do not do a meta-analysis. If I-square is very high, it really makes no sense reporting such forest plots or such pooled estimates rather. So don't report a pooled estimate when the I-square is very high. We can try exploring the reasons for heterogeneity, and we can try doing what we call as a subgroup analysis. So if you can have a closer look over here, the I-square, overall I-square here is 91%. So after that, we have done a subgroup analysis. We have tried and we have seen that there were two different regimes. One was an oral regime and one was a local application of this drug. So, and in the oral regime, we can find an I-square of 0%. So we can really rely on this particular forest plot where we are getting a good data, and I-square is 0%. So a simple understanding is, if there is an I-square, try to look into the methodology, try to look into some kind of a heterogeneity, methodological heterogeneity, and if possible, try to create some subgroups, and you might be able to get a meaningful outcome. Perform a random effect meta-analysis. At times, performing a random effect meta-analysis can answer a lot whenever you find high heterogeneity. Reconsider the effect measure. MD means mean deviation versus standardized mean deviation. So you can reconsider switching it over, and exclude the studies or perform the sensitivity analysis. So in paucity of time, I'm not going into details of how to exclude and how to perform sensitivity analysis. All I need to say is that if you are making these changes, do report them, and you have to be very cautious, because ideally speaking, all these steps have to be pre-specified in the protocol itself. I mean, you cannot just keep changing things as and when they appear. So that is not considered as a good practice. So right in the protocol itself, you have to address, or you have to specify the ways and means which you will be using in case heterogeneity is being reported as high. So just to sum up this presentation, systematic reviews typically involves a detailed and comprehensive methodology with the goal of identifying, appraising, and synthesizing all relevant studies on a particular topic. Properly implemented systematic review and meta-analysis yields powerful results that guide clinical practice and policy making. Thus, it is imperative to properly understand the review process and data pooling to ascertain whether the quality of the evidence generated is reliable or not. I'm sure there must be some questions regarding whatever we have discussed in this presentation. I would be happy to take them. Thank you.
Thank you so much, Dr. Arpit, for such a wonderful talk and clarifying all the confusion and in the concepts which were there earlier, I think, in the participants. I think you have really explained how to interpret the results of pooling, that means the forest plot, and explaining the nuances of various things like heterogeneity, how we measure it with I-square, chi-square, how we take care of it, how we reduce methodological heterogeneity. So these are very important points, because ultimately when we go to grading of evidence, these things become extremely important, like precision, heterogeneity, validity, all these things are taken into account when we are looking at the grade of that particular evidence. Although we are not discussing grade today, but I think that is something which would be a natural consequence of your talk. So I think now we have any questions on the chat box. I think he's
Yes,
there.
ma'am.
Dr. Sarita Kumari, can we conclude? Where has it gone? Can we conclude with an estimate from proportional meta-analysis for single group? Is that important for other studies, or as it really makes a sense of reporting the overall estimate from a proportional meta-analysis for a single group? I think this type of questions can be answered only when you have data in front of you and what actually you're talking about. There's something like proportionate meta-analysis. Would you like to take up this question? I mean, I thought that there was some.
Ma'am, I'm sorry, but the question is not very clear to me.
Not clear to me also. So actually, unless you have, the real problem which is in front of you, then only you can advise. If the I-square is high, should we use random effects model and interpret our results, or should we not present? Yeah, I think use random effects model first and then see.
One way of doing it, even after using random effect models, there are cases that we can get high I-square. So in that case, it makes no sense. So it is one way of trying reducing the I-square, I mean the heterogeneity. So that is one of the ways, but we may or we may not succeed. Similarly, we can do a subgroup analysis. So even after doing a subgroup analysis, we may or may not succeed. So these are some steps, but we may or we may not succeed. Ultimately, but if I-square is very high, it makes little sense, or let's say no sense, in presenting the pooled estimates.
I think they're asking whether they can do a proportional meta-analysis of one side only, like not having a control group.
So that is something prevalence study you are talking about, pooling the data from prevalence study. Nowadays, a lot of people are doing that. But there is a critique to that as well, because when we talk about prevalence studies, there is an ample amount of heterogeneity, methodological heterogeneity. I'm not talking about statistical, and there is no control group over there. So the estimates, the pooled estimates which we get, they are good, but again, there is a line written over there that these have to be interpreted with caution, because there are many limitations of such studies.
There's a question about publication bias. Of course, that is important. And it was shown, the funnel plot was shown in one of the previous presentations. And that also brings out the negative studies which are not reported. And that leads to publication bias.
And the grade, the grade approach, which is used to evaluate the certainty of evidence, it answers to your, it takes into consideration publication bias. I mean, that is a core component of the grade assessment. So grade publication bias is important, and that is why we do grade. After coming up with this data, coming up with this analysis, then we say we try to look into how certain we are about these results. So low certainty, very low certainty, moderate or high, something like that. So I believe, ma'am, half a day is too less to understand the detailed nuances of.
We have a separate workshop for grade, and so I think we can, Dr. Sarita Kumari Panga can discuss these things with Dr. Arpit individually later on. And we would like to thank Dr. Arpit for a wonderful talk. And, this is something which is coming out from a person who's done so many meta-analysis. So it's really very, very, very appreciated. So thank you very much. And Dr. Kusum, we go further then?
Yes, ma'am. Thank you, sir. Thank you for your presentation. Our last speaker for the workshop is Mrs. Parnita Pradhan. She is librarian in our center, in Center of Advanced Research and in Evidence-Based Child Health in PGIMER, Chandigarh. Actually, she is the main wheel of our cart of this evidence-based synthesis, because she is the initiator. She provided us all the help regarding the literature search. And as Professor Minu Singh used to say, if you are not doing a good search, then you will be producing garbage in and garbage out. This is the saying of Professor Minu Singh. She has been helping for the literature search from outside the PGIMER Chandigarh also. Many of the other institutes are taking her help for the literature search under the supervision of Professor Minu Singh. I would like to request her to present on the Cochrane library. And here she is.
And
If you are not audible, Pranita.
okay, ma'am.
Sorry.
Hope you're not muted. Yeah, now you're audible. Now you're audible.
Okay, ma'am.
Yes, please.
Okay. So today I will be talking about the Cochrane library, and under this talk I will be discuss about the various specific features of Cochrane library, how to conduct a comprehensive search through Cochrane library, what are the various limit search filters, and what are the various heads which are included in the Cochrane library. So, but before I go to the Cochrane library, I would like to discuss about the various steps which are included in doing search for the systematic review, either the Cochrane reviews or non-Cochrane reviews. So the very first you have to, for searching evidence-based medicine or systematic review, you have to look for the sources, and sources also divided into different heads, like whether you are looking for the electronic databases, gray literatures, hand searchings, or citation reviews. So in different electronic databases, we have PubMed and Cochrane Library, a Web of Science, Ovid, Embase, and Sinhal, Trip databases. So all these are the electronic databases. Apart from the electronic databases, we can also look for the gray literatures. Okay, under gray literatures, we have clinical trials registry. So if you go to the clinical trial registry, you will get the number of ongoing trials registered under this registry. So you can include this registry in your review also. So then we can also do the hand searching. In hand searching, you go to the library and look for the journals on your topic, and you can check hand searching through under that particular journal. Then you can also do the citation review. Citation review means you take the relevant review or articles or systematic reviews and go to the reference list which are included in that particular review on your research questions. So all these comes under the sources of sources for the systematic review. Then comes to the developing search strategy. After you finalizing the various sources, you have to make a search strategy. Under search strategy, when you received any research questions, just break this research question into PICO format or PECO format. As you already know what is PICO or PECO. PICO is population, problem, patients, or I is intervention, comparator, or outcome. So in PECO, we have exposure instead of intervention. So first thing you have to do after receiving the research question, break this into PICO format. Okay. After that, you make a concept-wise process. In every concept, you put the alternative terms for that particular concept. It is not necessary to include all the PICO terms in your research question. Like you don't need to include comparator, you don't need to include outcome in all your search. So it depends on the concept of your research questions. Then you have to accumulate all the alternative terms or synonym terms or if they're possible, control vocabulary terms, that is called medical subject headings, into one place. Then, according to your concept, combine your search terms or keywords with the help of Boolean operators, that is and, or, not. So after compiling all these terms and combining them with your Boolean operators, you can finalize your search strategy, and you can use this search strategy to different databases, because every databases have their own specific characteristics or specific limits or filters. So you have to use all these keywords or terms according to your database, databases you are using. Then comes documenting search strategy. When you search in the particular databases, always try to log in that database so that you can save your database, save your search for future updates. So you can easily edit your search, or if you need to remove any particular term or keywords, you can easily do these things. So you don't have to run your search from the scratch. So always try to log in your database and save your searches. Then setting up alerts. So if you have logged in, it is easy to set up alerts for your updated search, updated articles. So it will, if you have set up the alerts, the database always inform you or give you notification for any new search or studies added in that particular databases. So it comes under documenting search strategy. Then we have handling results and storing papers. So it will be done with the help of various citation manager tools. As we all know, there are a number of paid as well as free citation manager tools like EndNote, Mendeley, and Jotero. So with the help of these citation tools, what we do, we import all our search hits which are retrieved from the different databases and remove duplicates articles with the help of the citation manager tools, and export the title and abstracts for included studies for screening the title and abstract. So these are the various headings which comes under the searching for systematic reviews. So these are the various databases. So the Cochrane library, which I will explain you in my later slides. Then we have Web of Science, then MBase, Sinhal. We also have Ovid databases, then Trip database, and we also have Scopus. Apart from this, we also have the ongoing trials registry like Clinical Trial Registry India, clinicaltrials.org, or ICTRP, International Clinical Trials Registry platform. So there was one question that how to access the MBase database as there is a restricted mode. So sorry to say that all these databases, except PubMed, all these databases are paid databases. So you need to subscribe these databases so that you can use all features of these databases. If you are from the PGI, then you can easily get the access for all these databases through the main library, through CITAS library. So, and now coming to the Cochrane library. So what is Cochrane library? As it is a Cochrane library is named after Archie Cochrane, and it's a collection of various databases in medicine and other healthcare specialties provided by the Cochrane collaboration. And Cochrane systematic reviews and meta-analysis are the core of its collection, which summarize and interpret the results of medical research, and it recognized as the best single source of information on the effect of healthcare. The main aim of Cochrane Library is to make the results of well-conducted controlled trials readily available, and is a key resource in evidence-based medicine. So what is the objective of Cochrane Library? It is an independent global organization that collaborates to produce trusted synthesized evidence, make it accessible to all, and advocate for its use. And it is internationally recognized as the benchmark for high quality information. And it is a world of better health for all people, where decisions about health and care are informed by high quality evidence. So this is the home page or interface of Cochrane Library. As you can see that Cochrane Library in the topmost, you can do the basic search, and here you can see the Cochrane Library is divided into 5 different headings: Cochrane reviews, trials, clinical answer, about, and health. When you click all these down arrow, you will get the more information about all these headings. Then we have, whenever you search for any topic or any term, the Cochrane Library automatically divide these results of that particular term into the 6 headings. Cochrane review, is there is any Cochrane reviews or not, it will show in the Cochrane reviews headings, then Cochrane protocols, then Cochrane trials, editorials, special collection, and clinical answers. So these are the total collection of Cochrane library. So in Cochrane Library, there are around 8,800 reviews and 2,400 protocols and around 1.8 million central or trials articles are there. So this is one features of Cochrane Library which highlighted the most recent reviews or the most viewed reviews in this highlighted reviews headings. Then you can easily browse through the topic, and if you want to look for allergy and intolerance, just click on the allergy and intolerance, and it will give you the whole results of that topic. And from here you can do the basics as I already told you. But if you want to do the comprehensive search or you want to make a search strategy, then you need to go to the advanced search. Just click on the advanced search, and there you can see the 4 headings under the advanced search. First one is search, where you enter your search terms. Then search manager, where you manage your search and combines your search with your Boolean operators. Then you have medical subject headings, MES terms. Then you can also easily do the PICO search also. Just enter your PICO terms according to your research question and go to the search. Then it will give you the results of that particular PICO format. Here I have already entered one term, and just if you click on this down arrow, you will get the number of pull down menus from where you can menu or search fields, from where you can select your search field, like you have all text, or you have title abstract, you have author, you have DOI. So according to your need, just click your search fields. If you are doing the simple search, just click on the run search. But if you are making the search strategy, then you have to send your search terms to the search manager box. So click on the send to search manager. Under medical subject headings, just click on medical term or MES and start entering your search terms. When you start entering your search term, it will suggest the relevant terminology for your entry terms. So just click on the relevant search terms which you are going to enter, and just click on the look up. If you click on the clear, it will delete all the terms. Just click on the look up and it will take you to the search manager fields. Under medical subject headings, we have subheadings or qualifier also. So it will help you to limit your search or make your search more specific. So just enter your medical subject headings in this box and try to select your qualifier or subheadings from this subheadings box. So here I have taken a drug therapy as a subheadings for my term dental caries. So just click on the lookup and it will show you the results of this term's medical subject heading. So it will show you the definition, thesaurus matches for this particular term. Then if you want to explore all trees or just want to use single medical subject headings terms, so from here you can choose according to your need. Then to send your search into search manager, just click on add to search manager. So this is the final search details of my search. Here you can see I have make one concept, that is population, and enter all the synonyms or alternative terms for that particular term, then combine them with or Boolean operator. Then I have started entering the next concept, that is my problem. Problem, that is caries, enamel lesions, etc. So in this way, you have to make your search strategy. So in the search manager also, you can enter your medical subject headings directly, or you can enter your search terms. Just click on the medical subject headings, and if you need to add in between, you have entered 3-4 search terms and you have added, but you need to add one more medical subject headings or entry term, then you just go to the search manager and click on the downward arrow and enter your search term or medical subject heading. Then it will come in between your that search concept, all concept terms. And you can also search through the PICO format also. Just enter your search term according to your PICO and click on the run search. So in every database, there are some search limits or filters. Likewise, in Cochrane also, we have different types of search limits or filters. We have content type. You can also choose Cochrane reviews, Cochrane protocols, trial, etc. Then you can also limit your search according to your library publication date. Then we have first central trials. We have year, from which year to which year you want your search results. Just click here and enter the years. So in this way, you can make more specific your search hits. So in Cochrane reviews, there are some features which are very important to know, that when you click on the Cochrane review, it will show you these different headings. Just click on the issues, then it will show you the number of lists from 2003 onwards, and it will show you the different issues for every year. Just click on the 2021, it will show you the around 12 issues under 2021. So if you want to check according to the year, just go to the issues from the Cochrane reviews. Then another special feature is supplements. Under supplements, you will get the various conference abstracts of Cochrane Colloquium for previous years. So if you want to check any abstract of conference, you just go to the Cochrane reviews and click on the supplements. So I have prepared one research questions for this talk, that fluoride supplements for preventing dental caries in children. So first I have break them into the PICO format, like P is children with dental caries, because children is population or patient and dental caries is my problem. Then intervention is fluoride supplements, comparator is no fluoride supplements, and comparative outcome is prevention or adverse effects. So I have collected all the synonyms or alternative terms and make them according to concept wise. I have not entered any comparator or outcome in my this concepts headings. So in concept 1, I have written children's, then concept 2 caries, intervention, then concept 3 is my, or concept 2 is problem, and concept 3 is intervention. So I have tried to accumulate or gather all the synonyms here. So there is one question, that is there any systematic way to select keywords regarding the topic? The question was from Dr. Sarita. So ma'am, there's no any systematic way to collect the synonyms of alternative terms. But what you can do is just go to the PubMed and try to collect or try to find all the terms related to your review research questions or concepts. Then you can do one thing, that go to the try to take out any systematic review, not same but relevant to your topic, and try to see what keywords or alternative terms or medical subject headings they have used in their systematic review. So in this way, we have to collect the alternative terms or synonyms for our research question. So after this, I will try to take you, show you the Cochrane library, how to enter all these terms in Cochrane library and how to combine and what are the various limits or other features. So I will just stop sharing here and go to the Cochrane library. Okay, this is the home page, and I will directly go to the advanced search. When you click on this download arrow, as you can see, there are a number of, these are called search fields. So according to your need or according to your research question, just click on any search fields and enter your search terms and click on the send to search manager box. So it will take my search terms to search manager. Here you can see sodium fluoride. So in this way, you have to enter your search term. Then in medical subject headings also, I have already entered the term sodium fluoride, and there is the details of sodium fluoride under the medical subject headings, and they have given the definition of sodium fluoride, the thesaurus matches for this particular term, and phrase matches you can use as a phrase also. Then these are the search results of medical subject headings of sodium fluoride. Just click to the add to search manager. And scroll it down. And this is my mesh descriptor of sodium fluoride. So in this way, you can enter your search term and combine your search term according to Boolean operators. So I have already entered the whole search terms for this particular topic. So here you can see this is the first number 1 to number 5 is my concept 1. So I have used all Boolean operators. Then from number 7 to number 13 is my concept 2, and I have also here also I have used all Boolean operators. So in this way, you have to first make same terms in one place, then combine them with all. Then third one also. Then the final my final search is number 23. Here I have combined 6, 14 and 22 and used and Boolean operator. So I have found total 136 hits. And here I have used limits also. Here you can see that I have used the with Cochrane library publication date in the last 9 months. So if you click on here in the limits, here you can see that I have used the 9 months filter for these particular searches. Okay, so that it is showing only 136 results. If I click on the clear and remove this search filters, then the results is 1388. So that is the use of search filters or limits of particular database. So in this way, you can make your search limits more specific. So just to show the search results of your search, I will again go to the publication date, click on apply limit, and just click on the 136 is my final search results of this particular topic. So here on this topic, I have found total 3 Cochrane reviews. There's no any Cochrane protocols on this topic, and 133 trials. So just click on the trials. So these are the various trials under the Cochrane library. So these are the published trials, and you can see in some of them are unpublished or ongoing trials are also included in your Cochrane trials headings. So I'll show you this. In number 8, you can see that this NCT 05 NCT numbers. So it means the trial is not completed. So just click to see this. Just click on this, and it is registered under clinicaltrials.gov. If you need to, if you want to see the details of this particular trials, just click on the clinicaltrials.gov, and it will take you the home page or his main page of this particular trials. Here you can see supportive caries preventive program in children undergoing dental general anesthesia. So you can see that trial is undergoing, but the results is not posted yet. So the Cochrane library is also used as a gray literature database also, as you can see that the results is not posted or the publication is not done yet. So in this way, you can see the search of trials. Now, for systematic review, we have to export all the search results of every databases. So for exporting all these results, just click on the select all and click on the export selected citation, and you have to choose which citation manager you have, or which in which citation manager you are going to import your search results. According to that, just click on that particular format. As we have EndNote, just click on the RIS EndNote form and download. So in this way, you can download all the search results of Cochrane library. So from here also, you can use the search limits or search filters. From the left hand side, you can see there are a number of search limits like year first published, date of publication of a central trials database, and sources. There are sources also. So these are all about the Cochrane library. So if you have any query, you can ask or write in the chat box. Thank you.
Thank you, ma'am. Thank you for such a nice presentation. Now the session is open for the questions.
Pranita has given a very detailed account of how to search not only Cochrane library, but the other basic databases also, which are required for for doing a systematic review. But Cochrane library is a resource which is used by the users of evidence-based medicine also to a large extent, and you have to know how to interpret the Cochrane reviews and not just how to do them. So that is what, when you're reading a review, don't just read the abstract or the plain language summary. You should read the whole review and then actually get the full knowledge of status of evidence on that particular topic. So well done, Pranita, we as always. Thank you very much. Doctor, if there are any questions?
Yes, ma'am, there are a couple of questions in chat box.
regarding Boolean operators, for example, in PubMed, I want to search dental caries or cavity and also secretors. So in this case, what will be the search string? Actually, we are not providing the search strings. You can again ask her individually, because this will take a little bit more time. But Pranita, would you like to take up this question? There was a doubt about PubMed search in different laptops when the same keywords are searched are applied and the number of hits. Does that happen?
No,
With
ma'am.
different laptops? So it should not happen, because it's basically
It
database.
happens when you have used any search fields or any type of limits, then only there's a difference in searches.
Ma'am, this happens in Google, but not in other search engines. So
Yes,
if you are
yes,
doing it,
yes.
if you are just doing a Google search, so because you know that there is something called a search engine optimization, because they track you, they save some cookies in your system, and based on your previous search, they try to give new results which are a little different based on your previous searches. But otherwise, in these databases like PubMed and all, PubMed, Cochrane, and others, they are smart enough. I don't really foresee that different laptops will give different results.
Okay, so I think we would like to wind up the session. It's been a wonderful day. I guess today was declared a holiday in PGI. But I think it is very well utilized, and all the speakers who are with us, including Dr. Ashima, who sat through the entire workshop, and Dr. Arpit, of course, is always there with us to help us with the dental reviews, and all other faculty who have been there and participating from Lucknow, from Bhubaneswar, from Pune, and all other places. I think it's been a wonderful time having you here. Thank you so very much. I think we would send the participants and other faculties certificates for attending this workshop. And thank you very much. Dr. Kusum, would you like to wind up?
Yes, ma'am. I would like to request Professor Ashima Goyal for concluding remark, and Dr. Arpit Gupta also. Ma'am, please.
Yeah, Dr. Kusum, I wish to say that it was an informative workshop where all the speakers did their best to make the whole thing look very simple, and have motivated the faculty as well as the students, enough to at least carry on with or start with one systematic review at their level, so that they are able to finish it during their tenure. And considering the fact that Cochrane has a few timelines, like within a period of 2 years, you have to finish one review, and they keep giving you timely reminders as well. So it should motivate everybody to take up one and finish it within the specified time. Dr. Arpit, would you like to say something, please?
Nothing much, ma'am. Talking on the same lines, I would just like to thank the Cochrane India network, which under the leadership of Professor Meenu Singh is doing a wonderful job. And moreover, considering the fact that this is the first workshop and this is dedicated to the dental professionals, so it is really heartening to note that. Because largely speaking, there are hardly many workshops which are dedicated for dental professionals as far as systematic review and meta-analysis is concerned. So this is really a good beginning. And again, for all the participants, this is a sensitization workshop, and we look forward to meet you quite often in other workshops as well, where we can really, spend more time in and talk about, the detailed nuances of conducting Cochrane reviews. Thank you so much. Thank you.
Thank you, sir.
I would also like to thank Dr. Kusum. She has worked tirelessly for organizing this workshop and has conducted it so well today. And she is actually a scientist with us in the ICMR Advanced Center for Evidence-Based Child Health, and very adept in doing systematic reviews. And all the staff over here with us I would like to thank Dr. Pankaj Pant, who provides all the technical support, Amit Agarwal for being there and organizing everything. I think we've had a wonderful workshop. Thank you, Pranita, for telling us all about the Cochrane Library. So I think with that, we can end the workshop now. Thank you. Thank you so much, Dr. Ashima, for chairing the workshop and for being our guest of honor. Thank you so much.
Thank you, Dr. Mishra.
Thank you, ma'am. Thank you so much.
Thank you, Dr. Balendra. Thank you. Thank you so much.
Bye, ma'am. Thank you.
Bye. Bye, Lola. Thanks.